workers didn't.
Good morning, colleagues. A very good morning to you all. We'll start our meeting at exactly 9 o'clock. Let's wait for others to just log in.
Thank you, Chairperson. Good morning, Chair, and good morning to members and colleagues. Thank you.
Good morning, colleagues.
Good morning, colleagues.
Honorable Keza, I see that you have joined our meeting today. It means Honorable Siwisa will not be in attendance, or you just visiting us.
I've joined today, Chairperson.
Pay you a visit.
Colleagues and honorable members, may I please have the name of the colleague or honorable member who joined using Zoom user so that we can rename the gadget properly in the meantime.
Good morning, honorable members. It's Honorable Klaba from Gauteng Provincial
Okay.
Legislature. Thank you.
Okay, thank you, Honorable Club. I'm sorting out now.
Recording in progress.
Honorable members, members of the portfolio committees on finance from legislatures, esteemed stakeholders, members from the National Treasury, distinguished guests, and the support staff of the Select Committee on Appropriations, a very good morning to you all and welcome to the public hearings on the 2025 Division of Revenue Bill, Appropriations Bill, and Public Sector Pension and related bills. A very good morning to you, Mr. Nodada. I'm going to request that you confirm that everybody that's supposed to be here is here and give us the apologies so that we can directly start with the public hearing.
Chairperson, good morning, Chairperson, and good morning, honorable members and colleagues. Chairperson, with respect to members, we have the full complement of the committee, Chairperson, except for now, Honorable Khatebe, he is still attending another meeting. We have got the apology of Honorable Siwisa, but Honorable Geza has joined the meeting already. With respect to stakeholders, I did not note them one by one, Chairperson, but there are stakeholders who have already joined the platform, Chair. So I think we'll be guided by the agenda of the committee as and when we are calling them to make their submissions. Thank you, Chair. But in total, we are expecting 8 stakeholders, Chairperson, who will be making submissions to the committee. Thank you.
How many provincial legislatures do you think we have in the meeting?
The only member that I have noted now is Honorable Tsaba from Gauteng. Let me just scroll down, Chairperson, and see if I'm not going to be able to recognize other members that I know.
No, it's okay.
Besides colleagues, Honorable
Let's just
Tsaba.
say for now we only have Gauteng.
Oh, and Honorable Mosai Gauteng, Chairperson. Thank you, Chair.
Thank you very much, Gauteng, for joining us this morning. Colleagues, I must indicate that it is my honor to open this public hearings of the Select Committee on Appropriations, as we'll be deliberating on the 2025 Division of Revenue Bill, the Appropriation Bill, and Public Sector Pension and Related Payments Bill. The bills determine how the country's limited fiscal resources are allocated to meet pressing developmental priorities across all government spheres. As part of our constitutional oversight role, we welcome the valuable insights brought by civil society organizations, by trade unions, research institutions, legal advocates, and community stakeholders appearing before the committee today. Your submission offers critical reflections on education funding, rural healthcare, equitable share allocations, fiscal transparency, infrastructure delivery, social protection, the climate resilience, and the public sector capacity. Today's engagement aims to probe these submissions deeply, extract actionable recommendations, and strengthen our final report to the National Treasury and the Executive. As the committee, we remain committed to ensuring that the budget process reflects both constitutional obligations and the lived realities of ordinary South Africans. Having said that, you are most welcome to the public hearings, colleagues. And I must indicate that, as Mr. Nodada has already mentioned, we only received 8 submissions from stakeholders. We do not have written submissions. All the stakeholders will be presenting before the committee today, and each stakeholder will be given 15 minutes to make their presentation. After the 8 submissions or presentations by stakeholders, I will then give an opportunity to members to seek for clarity on the presentations made or to engage the presentations as been made by various stakeholders. Colleagues, you have an agenda before you and will follow the list of stakeholders as they appear in the agenda sent to your good selves. But before anything, I must indicate that members, it was previously agreed by the committee that it will not be the usual response, we will not have a usual response from the National Treasury. After this public hearing, we'll expect the National Treasury to respond in writing before the cut-off, before Friday midday. They will have responded to all the issue on the said bills in writing, and then on the 9th of July, members will get an opportunity to engage on the written responses, which they will have received this coming Friday. And I should indicate that the responses will be sent to all the stakeholders, and the responses will also be sent to provinces so that they have all the responses and the insight of the deliberations on the said bills. Having said that, members, I'm going to award the first stakeholder or invite them to come and make their presentation. Breadline Africa, you are welcomed, and you may present for 15 minutes to the committee. Thank you very much.
Good morning, everyone. Thank you for having me. Will my presentation be put up?
You have the co-host rights, Warren. You can do it from your side.
Okay, perfect. I'll do that now.
Hello, Chairperson.
Yes, Mr. Nodada, we are just waiting for both yourselves and Mr. Warren to start the presentation.
It looks like he has lost a connection, Chairperson. Maybe we may decide to take the next stakeholder
kindly
and
contact
then
him and tell him that he'll come later. Can we get a presentation from Rural Health Advocacy Project, if they are ready?
We are ready. Good morning. Could you please allow me to share my screen?
Mr. Nodada, assist. And colleagues, the Secretariat, I'm going to request that you be ready with other presentations in case there may be a need for you to assist with screening or sharing the slides from your side. Warren, I've already invited the Rural Health Advocacy Project. You will come after them. I see that you are back in the meeting. I'm sorry for that. We were made aware that you were kicked out by the system. So let's allow them to present, then you will present second. Over to you, ma'am.
Thank you so much. Good day, Chair, and everyone who has joined us today, and thank you for the opportunity to speak on this platform. I'm Celine from the Rural Health Advocacy Project, and we advocate for equitable healthcare in rural areas. Healthcare in rural South Africa currently stands at a critical turning point. As a country, we cannot grow or stabilize without making sure that every person, no matter where they live, can access their basic rights. That includes access to healthcare, as promised by Section 27 of our Constitution. Our Finance Minister recently announced a 20 billion rand increase to the national health budget over the next 3 years. He also committed to hiring 800 unemployed doctors. This progress is welcomed, but let's be honest, it may not be enough. Most of the money will go towards increasing salaries, which means very little is actually left to improve healthcare services on the ground, especially in rural areas where people already are struggling the most. While hiring more doctors is something to celebrate, there's a real danger that money will be taken away from community service roles. These very roles that support rural clinics and hospitals. These roles are a key entry point for young doctors and nurses to serve in rural areas. Without them, rural communities actually lose access to care, and young professionals miss the opportunity to gain experience and make a difference where it's needed the most. This budget increase doesn't make up for the funding we lost at international level, like from donors like PEPFAR, for example. Their support was critical, especially for HIV and TB services in 27 of our districts, most of them being rural. Now, many of those services have been cut, and people who rely on them have been left behind. So when we put all of this together, the salary increases, the loss of donor funding, and the rural needs, we see the truth. This budget, although it's bigger, still does not meet the needs of our rural communities. And that means that it doesn't meet the needs of our country. Rural people have been historically excluded and overlooked, and that we cannot allow to continue. Poor access to healthcare affects their lives, their work, and their ability to contribute to our economy. So we have the tools. Since 2015, the Rural Health Advocacy Project has been rural-proofing our health policies, making sure that they can work outside of just the cities. Some progress has been made. So for example, we've improved how funding is allocated, and we've included rural voices in planning, but we're still very far from where we need to be. Let me share some quick examples with you. So for example, in maternal health, adolescent pregnancy rates in rural provinces like the Eastern Cape, the Northern Cape, and in Mpumalanga are some of the highest in the country. Places like KwaZulu-Natal have antenatal care coverage that is below 65%. That means that young girls aren't getting the care that they need when they need it most. Many facilities are running out of contraceptives, and 69% of rural girls don't even know where to seek help when they need it the most. If we then look at non-communicable diseases, we're seeing a crazy diabetes crisis, where rural women have dangerously high sugar levels. Limpopo has one of the highest number of new cases, yet is actually one of the smallest provinces by population in our country. In places like Amatole and Ugu, treatment coverage is far too low, at just 28% and 38% respectively, while the national coverage is 35.8%. If we then move over to communicable diseases, we see that diseases like TB and HIV in rural areas have an especially high burden rate. HIV prevalence in rural areas sits at nearly 28%, but these areas only receive a small portion of donor funding. Things like stigma, distance, and under-resourced facilities make the fight against TB and HIV so much harder in these regions. So our message is clear. South Africa has a lot to do to change the story of rural healthcare. While the budget is a great start, money alone is not enough. What matters is how we use it. Salaries are important, yes, but so are the medicines, the outreach services, the transport, and the trained staff in our rural clinics. We have strong policies. We just need to implement them properly, urgently, and with rural realities in mind. Because at the end of the day, the budget is not just about numbers, it's about what and who we prioritize. Thank you so much for your time.
Thank you so much. Breadline Africa, you may come in.
Thank you very much. Let me share my screen. Perfect. Can you see my screen?
Yes, we are able to see your screen.
Perfect. Thank you again for letting me have this opportunity, and welcome to everyone in the meeting. Sorry, let me just hide that. So just a bit of context on who Breadline Africa is. I know that we have submitted before and presented before, but our main focus is to be the leading infrastructure non-profit impact catalyst for the early childhood development sector. Our focus is on classrooms, kitchens, libraries, as well as the pit toilet campaign, where we demolish and replace with flushing toilets throughout KZN, Eastern Cape, and Mpumalanga, Limpopo. Currently, in 2024, we did over 200 ECD centers, reaching 18,000 children, and we partner with communities, government, and other non-profit organizations to achieve the 5 components of the Nurturing Care Framework. And our mission is obviously for every child that they deserve a safe space to learn and to thrive. On the left, you'll see our map where we have placed infrastructure over our 32 years, which is today is our 32nd year birthday. So happy birthday to us. So onto the bill, and why does it matter? Well, the bill allocates nationally raised revenue across national, provincial, and municipal spheres. And education and ECD services are mainly funded through these provincial equitable shares, as well as conditional grants. And the bill will directly impact the landscape for ECD subsidies, school infrastructure, municipal support for ECD registration and compliance. I know that a lot of people might point fingers at what could be done better, but I think we need to acknowledge the positives. The increase of 24 Rand per child per day. This is an asterisk because it's also dependent on the child qualifying, or the parents qualifying for that grant, moving it up from the 2019 number of 17 Rand a day. I know that we still have a long way to go with this. The expansion to go up to 700,000 children, infrastructure support, registration and minor upgrades sustained through conditional grants. And I think we must also mention the Banapele drive, which is also pushing registration, which is then leading to ECDs and principals applying for these grants. We still have a long way to go, but at least we're in the right direction. ECD infrastructure grant, this is maintained despite fiscal pressure. Just to comment on the infrastructure itself, I think it came from DBE, where the comment was that there's no money to be building new ECDs. This infrastructure we mentioned here is to help save ECDs that are currently falling apart in villages and in townships in our cities, where teachers are sitting in a 1-bedroom shack that is currently falling apart, and we are trying to help. General alignment with the National Development Plan and the National ECD policy goals. These are all great positives, and I think we have to acknowledge the good work that has been put in. There are, of course, going to be concerns. The 24 Rand a day is obviously below the 36 Rand a day for quality, which will help feed as well as with sanitation of these children, as well as educational tools and books. So the lack of targeted conditional grants for ECD infrastructure, there's no dedicated stream. Persistent infrastructure backlogs in rural schools and urban informal settlements. As I just mentioned, we battle to get firstly the approval through municipal and city building plans to help save an ECD which is currently working out of someone's home or a shack that is currently falling over. Municipal capacity gaps, they slow down the delivery and registration of ECD centers. This goes hand in hand with building plan approvals. And inflation and delays, disbursement and cost increases reduce real impact. Recommendations from our side, obviously to increase the subsidy. I think we also need to put context to the subsidy. Not every single child will get this per day. There needs to be a qualifying level in order for a parent to be deemed below the threshold, where a child will then be subsidized. So I'm not looking to increase 36 per day times 700,000 children at ECDs. It's the ones that qualify. And unfortunately, this leads from ECDs becoming registered first. Again, the Banapele drive is helping this. Introduce dedicated conditional grants for infrastructure. Boost capacity at provincial and municipal level to deliver these commitments. Improve coordination across Treasury, DSD, DBE, and the municipalities, which is key. Municipalities can sometimes be the hindrance in accomplishing these goals. And ensure allocations reflect the Section 28 of the Constitution, the UN Convention on the Rights of a Child, and the real cost of inflation and delayed implementation. Why does this matter? ECD is foundational. I mentioned it in my last submission that grade 4s, we have the lowest literacy level in the world. I think 81% cannot read for meaning. And this starts at ECD level. It impacts lifelong learning and development, as well as social equity. Investment in these early years brings the highest long-term returns for society. And we see the urgency and opportunity to address these inequalities, empower communities, and ensure that no child is left behind. It's cliche, but the children are the future. And unfortunately, when they can't read, what does our future look like? I just wanted to bring a comment on the SALGA that was released the other day, and that we echo the concerns that the underfunded mandates and poor municipal capacity, children in informal areas are disproportionately affected by delays in infrastructure, water, sanitation, and registration of ECDs. So Breadline supports the broader SALGA call for urgent fiscal reform. And we add, if local government fails, it is the children in informal settlements and rural areas who lose the most. We just call for equity and target investment, putting our children first. In conclusion, we appreciate the progress reflected in the bill, and more is needed to protect and uplift vulnerable children. We remain committed to working with government as well as other non-profit organizations to ensure that every child has the opportunity to grow and learn. I just want to hand in an apology that if I do miss the questions at the end, I do apologize, and you please are welcome to contact me. I have just arrived in Kambako village, Limpopo, where I am going to hand over a library to Vulakanjani Primary School this afternoon, or at 11:12. So if I do miss, I really want to extend my apologies, but please know that I am always available to contact. And thank you very much for your time.
Thank you very much for the presentation, and a happy birthday to Breadline Africa. Once again, your apology is been noted. Let me now invite TB Accountability Consortium to give us their presentations.
Thank you so much, Chair. Have I been given sharing rights yet?
Yes, Sihle, you have them.
Thank you so much. Can everyone see my screen?
Yes, we are seeing your screen.
All right, thank you so much. Good day, Honorable Chair, as well as to the other honorable members. My name is Sihle Mohangandawonde, and I'm here representing the TB Accountability Consortium, which is a growing platform championing in making TB a national priority. And we have titled the submission, A Call to Course Correct in Ending TB. And I would like to pose to you all this question. Do all lives matter? In the last 12 months, an estimated 56,000 people died of TB. Yet TB is a treatable and preventable disease. And since the first budget was tabled 105 days ago, 15,873 people have lost their lives to this disease. Since there has been very much a lot of political contestation around the institutional arrangements of government, it must be reiterated as being one of the millions of South Africans, myself, of the Section 27 right to health. And this is expanded within the National Health Act, Section 61, which is in establishing a unified national health system to ensure equitable access to health services across the provinces. And within this context, the state is legally obligated to fund and expand TB services. And this is especially for vulnerable and underserved populations. Yet, we have seen since the January 20th announcement that underfunding, staff losses, and grant shortfalls undermine the progressive realization of access and threaten the gains made under the End TB strategy. This, honorable members, is a global strategy set out by the World Health Organization. The reduction in TB incidences, this meaning the rate of TB cases developing within a population, and mortality is contingent on fulfilling these constitutional and legislative commitments. So, publicly funded healthcare is in distress. And since the March budget, the situation has worsened significantly. Allocations to health have decreased in real terms over the last decade, despite increases in the cost of health and various pressures on the system. Provincial departments are struggling with conditional grants, and with the withdrawal of overseas development assistance has resulted in significant funding gaps in response to HIV and TB. We see that 20 billion has been allocated to health over the 3 years, and this includes the equitable share increase. But 6 billion per year will not be sufficient to meet these challenges, and gains in HIV treatment are at a significant risk. We see chronic underfunding, as noted by the minister, and this has contributed to provincial governments carrying over budget shortfalls in excess of 22 billion rand. As I've mentioned, the withdrawal of overseas development assistance has resulted in the loss of 15,000 frontline staff and a further 9,000 technical staff. This in turn has removed the operational capacity in rendering TB and HIV services nationwide. So we see South Africa's ambitious End TB campaign, and over the last 10 years, the National TB Program has halved TB incidences, and this is a success. We've increased case finding and we have reduced deaths, but this is still not enough. Our country's TB program has launched an ambitious End TB campaign, which aims to test 5 million people within the 2025 and 2026 period. And to achieve our End TB targets, we need to accelerate case finding and scale up testing as recommended in the End TB campaign. We see incidence rates have reached the 2025 End TB strategy targets, but SA still has to increase treatment coverage rate by 13% and reduce deaths by 46,000 per year. There are about 65,000 people who are termed missing, and we know that they have TB, but they are not on treatment. If we can reduce this number, we can reduce the TB burden. We are aware that through the SA National AIDS Council, an establishment of a TB caucus is in the works, and our hopes as TBAC is that this caucus aims to engage members of parliament, especially from the portfolio committees of finance, health, social development, and appropriations, in a focused discussion to enhance the understanding of this TB epidemic in South Africa, and capacitating them in supporting the national Close the Gap and End TB campaigns. But with everything that is ambitious, there are risks that are at hand, and healthcare is primarily managed at a provincial level. Here, there are competing priorities, and this includes the previously mentioned 22 billion in accruals. We only have 3 out of 5 million tests funded to reach this target, and there are disparities in testing capacity at each province. And in addition to this, there is a 4 to 6 billion rand funding gap for this HIV Close the Gap campaign. There are general capacity problems where we see medicine shortages, the shortages of doctors and nurses within provinces. And these are issues that have been long-standing and have now been exacerbated with these funding cuts. While the additional allocations will fund public sector wage increases, together with the allowance of the employment of 800 healthcare professionals, our concern is that there will not be enough money that will be allocated to meet the funding needs for this End TB campaign. And so our recommendations are that we call upon members of the National Assembly, as well as this National Council of Province, to request provincial departments of health to submit plans on how they're going to avoid increased TB deaths. Interventions within the End TB campaign, as well as the Close the Gap campaigns, should align with evidence and with high burdened TB provinces, and these are the Eastern Cape, KwaZulu-Natal, as well as the Western Cape, within the equitable share, and these provinces should make representations at a national level. Our second point is that we're asking for you to review allocations for the conditional grants. We are asking the National Department of Health to provide detail on how the District Health Program conditional grant has been reprioritized to ensure that lives are not lost. And our third one is a joint sitting of the Finance, Health, and Appropriations Committees to ensure that it receives the sufficient political priority that this so deserves. Honorable members, 56,000 people do not need to die from TB each year. And during these proceedings in these 2 hours, 7 to 14 more people would have died from TB. And again, I call to you to course correct, honorable members, that aren't these 56,000 deaths not grievable lives as well? I know that the sitting is really 50-50 within men and women, but men are the most people that we see that die from this disease. And I say my quote from the author John Green as my closing remarks. We know how to live in a world without tuberculosis, but we choose not to live in that world. Thank you, Honorable Chair. We appreciate this opportunity.
Thank you very much. Section 27, you're invited to make a presentation.
Good morning, Chairperson. Good morning, honorable members. Have I been given hosting rights?
Yes, Ndu, you have them.
Okay. Good morning again, Honorable Chairperson. Good morning, honorable members. My name is Nkuduzi Nkosi. I'm a budget researcher at Section 27, and I'll be presenting our submission to the committee on behalf of Section 27. So, by way of introduction, a quick review of who we are and what we do. So, Section 27 is a public interest law center that seeks to build accessible and equitable healthcare systems that work for all South Africans. On to the budget now. So this budget is presented against a backdrop of years of budget cuts that have weakened both the health and education systems. Because of these cuts, in the past years, we've seen that the healthcare and health departments and education departments have been hiring fewer doctors, teachers, and nurses, and even fewer doctors and nurses have been retained. And because of this, we've seen that over the years, service delivery has worsened, especially in underserved communities. That is to mean communities in rural areas, communities in townships, and so forth. So this division of revenue bill is the third iteration of the budget for this year. In the first two budgets that didn't pass, we had noticed that there were real increases to allocations to healthcare and education, but because of the proposed rate hike in those two, they didn't pass, and therefore we had to go back. So this third iteration of the budget continues with the real investments or real allocations, real increases in allocations to healthcare and education, making a shift away from years of deep austerity and investment in education and healthcare. And we're happy with that part. However, we caution that there's still a long way to go in terms of allocations and additions to the two sectors to reverse a decade of underfunding for public services. More positive shifts that we see in this year's budgets are there's a restoration of funding for critical infrastructure and frontline services. Of course, we're happy with the reversal of the VAT hike, and most importantly, we welcome the modest but meaningful improvement to the social wage. despite all the positive, there are still concerns that we have about this year's budget, chief of which is the fuel levy increase, which we believe will add a lot of pressure to public services, especially the National School Nutrition Program, which we'll speak to later. We're concerned with persistent underspending and corruption in provincial departments. One example is again the recent underspending of cancer funding in Gauteng by the Gauteng Department of Health. In terms of the division of revenue pool itself, we are concerned with the lack of fiscal buffers and a very much reduced contingency reserve, which we think will have is a risk to the fiscals for this year. As we have done in the past, we always call for the government to do more to strengthen capacity in provincial departments. For this year, our main concern is the issue of corruption and mismanagement in provincial governments. We call on the government to do more to strengthen consequence management, for example, non-compliant service providers, and to improve and maintain accountability systems in case there's malfeasance. So the key recommendations, again, we call on the committee to assess the impact of the fuel levy. As I've said, the fuel levy will likely increase the cost of delivering services like the National School Nutrition Program and medical services, which rely a lot on fuel to deliver services. And there are no exemptions for the poor there, unlike zero rating that would have come with that. Excuse me. We believe that there are alternatives to the fuel levy, and as part of the Budget Justice Coalition, we've made submissions on some of these alternatives. Another recommendation we have is that for the committees, that there should be a strengthening of oversight for personnel and hiring, including making sure that the increase to personnel funding in this year's budgets don't just go to wage adjustments, but are used for new hires as well. And this can be done through monitoring the hiring rates of teachers, doctors, and nurses at the provincial level. Thirdly, we call on the state to do more to tackle the scourge of ghost employees and payroll abuse in provinces, mainly through verification of the workers that are there, through cross-checking payroll and attendance, and enforcing consequence management in cases where there are ghost employees, but management is not doing anything to stamp it out. We also call on Treasury and to reassess the impact of cuts to health infrastructure and EMS. This year's budget will include cuts to healthcare infrastructure and EMS, and we believe that this will have an impact, especially for rural healthcare. Last on the recommendations part, we call on the state to accelerate gender responsive budgeting. I will skip the part of gender responsive budgeting, except to say that we still believe that we still have a long way to go in terms of gender responsive budgeting for the budget. Moving on to the provincial equitable share, here we are happy to see that the 33 billion rands increase to the PES that were proposed in the first and second budgets is maintained. However, we caution that this increase will be dampened by the effects of the accruals that provinces have been facing, which amount to 22 billion rands, and the higher need for services that we'll see in provinces because of immigration and so forth. On the spending of conditional grants, we're still concerned with the underspending of conditional grants in healthcare and education. We caution against the practice of reallocating funds to better performing provinces in cases where some provinces underspend on conditional grants, as this does not mean that there's no need for the funds anymore, but rather means that challenges to capacity and on delivery on the services. On personal funding, we're seeing that there's an above inflation increase to personal funding in this budget. Again, we hope that the increase does not just go towards adjusting wages for existing employees, but also it's also used to hire new employees for public service. We urge Parliament to ensure that there's the 6.7 billion rand that is provisionally allocated to healthcare staffing in the budget is fully realized and provinces can have access to it so that they can hire much needed doctors and nurses. On education, on overall education expenditure, we see that budget 3.0 maintains the real increase to overall budget, to the overall basic education budget, which is a 2.5% increase in real terms for the year. If well spent, this could go a long way towards addressing some of the challenges that we see in the education sector, including teacher shortages, overcrowding in some schools, and infrastructure backlogs across many provinces. However, it seems workbooks and learner teacher support materials as a budget item remains under prioritized, seeing a real cut of 1.4% this year, which could undermine literacy and learning outcomes for schools. On infrastructure, we're happy to see that the IEG, or the Education Infrastructure Grant, remains unchanged when compared to the first and second iteration of the budgets. There's a real increase there of 4.9%. Despite its strong performance, we've seen that in times where there's been expenditure moderation and cost containment, this has been cut in year. We hope that the government will continue to ring-fence this grant to ensure that it is used for the purpose of upgrading infrastructure. The SIPG, or School Infrastructure Backlog Grants, continues to be reduced in both nominal and real terms. The main reason given for this is that the grant has been performing poorly, and we caution against that again because it does not mean that there's no need for infrastructure anymore. It's just that there are problems with delivery and project management. But we are happy that it's going to be absorbed to the IEG in the next financial year as indicated, and we hope that the levels of funding for both grants, even when they're made, remains as high as they are in this budget. On earlier childhood development, we echo the sentiments of some of the presenters that came before us. We're happy that there's a increase to the item as in the budget, much of which will go towards the ECT subsidy and extend access to 700,000 more learners, nearly doubling subsidized enrollment by 2028. On NSNP, our main point here is the impact of the fuel levy on the allocation. As I've said before, the increase in the fuel levy will likely erode some of the gains that have been made in NSNP, and we call on Parliament to have a look at some of the impact that the fuel levy will have on the NSNP. On healthcare expenditure, the healthcare budget increases in both nominal and real terms as well. This is the first real investment that we're seeing in the sector since 2022, despite it being 3 billion lower than it was in the proposed March budget. However, due to increases in population, we're seeing that the per healthcare user spending will decline by 1.9% in real terms, showing a growing need, a growing demand for healthcare services in South Africa that has not been met with corresponding increases in allocations in the budget. Healthcare personal allocations to the healthcare sector will increase as well. As I've said, we hope that the 6.7 billion that's provisionally allocated towards hiring new doctors is fully realized sooner than later. On healthcare infrastructure, the budget increases by 2.6% in real terms. This is also the first. Sorry, I've gone through this part. All right. On HIV and AIDS funding, which is funded through the district health programs grant. This is increased by a marginal 0.8% in nominal terms, which in real terms is a real cut of 3.1%. In the past, the rationale given for this was that there's been rationalizations in the grant that have made it cheaper to acquire medication for healthcare, for HIV and AIDS healthcare. However, with the withdrawal of PEPFAR funding, this is likely not the case, as there's going to be an increase in the number of people that require healthcare medication, and we hope that the Treasury addresses this sooner than later. I think that's it from my side. Thank you, Chairperson. I'll wait questions at the end. Thank you.
Thank you very much, Mr. Nkosi. Budget Justice Coalition, you are invited to come in.
Okay, good morning, Honorable Chair, honorable members. I'm just sharing my screen now, and then okay, 2 seconds. Okay, I'm assuming that everyone can see my screen and I can start.
You may proceed.
Thank you very much. So good morning, Honorable Chair, honorable members, everyone in attendance. Thank you very much for the opportunity once again to make submissions on the Division of Revenue Bill. So I am Matsidiso Lengwasa, currently chairperson of the Budget Justice Coalition, and I am doing this presentation on behalf of our researcher, Lisa, who couldn't do it. So we made submissions to this committee for years. So just for maybe people who don't know, that the Budget Justice Coalition is about 24 civil society organizations, and then a few more friends and individual members who come together really so that we can advance a budget that is by the people, for the people. And really to wield the power of the budget to advance, to build an economy that in turn builds a nation. And so we are very interested in this bill in particular, and really, you know, we've engaged with all three versions of the 2025-26 budget, all three iterations of it. And our overall view on this bill and this version of it is that it does mark a turning point from harsh austerity that has been persistent in the previous versions of this bill in previous years, which we had been criticizing, because for the first time since COVID-19, we've seen non-interest expenditure increase or grow in real terms by 0.8%, which is really the first time, and it is progress. But we also recognize that this is not enough to undo the damage that has been caused by past cuts, nor is it sufficient to meet the urgent needs that are facing communities today. And what you'll see is that some programs in real terms or will have increased, you know, above inflation. But then when you take into account the participation or the number of healthcare users, you'll see that there's some real cut, or health or other programs, there's some real cuts, but we'll talk a little bit more about that in this presentation. And then also to just say that spending without delivery isn't progress, because any of these gains to allocation in allocation can be undermined by poor implementation and weak accountability. And we really see the role of this committee, as we've seen in previous years, but as we're seeing context where the budget is becoming more significant, both politically and to people in this country, we see the role of Parliament in really strengthening that implementation and oversight to ensure that all of these allocations, every single rand that is allocated actually goes to intended beneficiaries in the country. So our submission is also informed by engagements that we've made with communities. So this year, the BJC has been fortunate enough to be able to engage with communities across the country. And after this submission, we're actually going to be engaging with communities in the Northwest to get a sense of what they would like to see in the budget and in the budget process, not just the allocations, and how can the budget, including this bill, work to empower and to serve those communities. And some of the consistent themes that have come up from our community engagements have obviously been around education, overcrowded schools, and classrooms that are still built of inappropriate materials. 31 years in a democratic South Africa, and we still have these issues. Healthcare also, what came out, especially that was especially pronounced, was in Limpopo. One clinic served 192 villages in some areas, which is something that was really concerning for the members of those communities. We've also heard consistent complaints about law and justice. And though in previous years, the BJC didn't really get into police budgeting in the same way, but because of the consistent cries from community members, especially around court backlogs, delayed cases, and how the police stations serve so many people and they're constrained in the ability, as well as corruption. We're really hoping to shed light on those and see how the budget and how this bill in particular can help to alleviate some of those issues. Other issues that obviously come up, of course, is youth unemployment, especially for some of the older people, like the grannies in communities would complain about their grandchildren being graduates and sitting at home without work for years. They're ready to serve the country and ready to contribute and build and participate in our economy, and yet it just seems that the economy is not creating enough jobs to absorb these graduates. So that was something that also came up that was concerning. Other things that were concerning was the SRD grants, which is which has been spoken about a lot, and how insufficient it is, especially in a context where the economy is not creating sufficient jobs. What was also new for us was agriculture and women farmers calling against corruption in land allocation. Water issues were persistent in rural areas, but also in urban areas. So even in, like for instance, when we went to Protea South in Soweto, every time we went there, so the 3 engagements that we had, they would complain that they haven't had water, they haven't had running water for weeks on end, which is really concerning. And all of this, we're really just to say that these are some of the unfiltered voices of community members and marginalized people. And we urge this committee to really continue to see its role in advancing a budget that actually builds a nation and builds an economy that works for people, that alleviates economic vulnerability, and to take these demands with urgency to ensure that the budget reflects the realities of these communities and communities at large in this country. So in that vein, we really continue to recommend that this bill has participatory human rights impact assessments, so that every single decision that is being made around the budget, there are people, the lived experience is taken into account, because in that way, Treasury and governments can make better informed decisions about how fiscal policy impacts the everyday person, because that is who we're trying to serve. So for example, there's a World Bank loan that has recently been taken out, but it's one thing to take on international debt, but it's another thing to then explain, to apply human rights impact assessments to say, when we take on this debt, this is the impact that it could have on everyday people, and the impact that it could have on education and health rights realization in a context where of debt servicing costs, and this is what we're going to do to address that. So that's a big recommendation that comes out for us, and also to institutionalize gender-responsive budgeting. I mean, we've spoken at length with this committee, and grateful that this committee has passed this on back to Treasury around gender-responsive budgeting, and expanding this so that there can be public participation so that this GRP can actually be shaped by intended beneficiaries. But also to then expand it to include care sectors, the pilot to include care sectors like education and health. We're also calling on the child support grants to be aligned to food poverty line, as well as to legislate this SRD grant so that we can improve its adequacy, its coverage and eligibility in a context where the economy isn't creating jobs as rapidly as we'd like. So there are other things that just one last thing that I would also like to recommend is around a transparent, inclusive review of local government fiscal framework, especially as government is reviewing the white paper on local government. We need to be thinking about the role of fiscal policy and how we fund municipalities so that they can do the work that local government can do, the work that it should be doing. And lastly, the big recommendation that comes from us is to really expand public participation in a meaningful way. You know, we've learned a lot from the 3 budget cycles that we've had, but we're really just calling on to institutionalize public participation so the budget can actually be shaped by intended beneficiaries, by people in this country, and also for Treasury to be able to make good quality decisions knowing what is happening. Because, you know, in lieu of actual Treasury going into communities to find out how the budget will impact them, perhaps this committee may play a role in creating that bridge between policy making as well as the lived experience of people in our country. The other thing I'd also like to emphasize is on the fuel levy increase and the impact that may have, because it may raise the transport costs and food costs that will offset gains or increases that have been made to social programs, education and health. And we're really also calling on this committee to reflect on the submissions that we've made to the finance committees around the fiscal framework, which was passed, so that we can start to consider better alternatives that are more progressive, but also that can generate more than the meager 4 billion that the general fuel levy increase could have done. We really think that there are better ways to generate the revenue that will be divided in this bill, if that makes sense. I mean, I've already spoken about gender responsive budgeting. For the public sector wage bill, we just welcome that it has been retained, the increases have been retained, but we caution that it is likely that this 23.3 billion allocated will stabilize wages, and we're not so sure if it'll be enough to expand the public workforce and the frontline services. The provincial equitable share, I think other member organizations have covered that, have also covered conditional grants, especially education. I think Section 27 covered that. But with the health conditional grants, I just want to note that even though it looks like health is getting some of its highest increases, I think that the committee must also look at per healthcare user, because the number of healthcare users seem to have gone up quite significantly over the past few years, meaning that even though we've increased above inflation, when you look at per healthcare user, there are real-term cuts. And so we're actually disinvesting in our healthcare system. And how will we universalize healthcare access and the Section 27 constitutional rights to quality healthcare if we're actually reducing the resources that are available? And then, I mean, we've spoken about social protection and child support grants to really just align to the food poverty line in a context where unemployment is persistent in our country. So really, as we industrialize and build our economy, we should also be ensuring that we have these social protection interventions that can protect economically vulnerable people in our society. We're also bringing to attention land and agriculture, because some key agriculture grants have retained increases, which we welcome, but there have been complaints of grants that have not been spent at all. And then at the same time, rural communities, especially women and smallholder farmers, complaining about corruption. So I think that there should be strengthened oversight around land and agriculture. And we've made submissions over the past few years, but I don't think there have been specifically around agriculture. So that's something new that we'd like to bring to the attention of the committee. The public employment program, we continue to call for it to be expanded, and there should be some clear oversight around the impacts that merging the EPWP grant will have on gender equity particularly. I think that's really important. And then for local governments, I've spoken about the white paper, but if there's anything that comes out from our engagements with communities, is that this water crisis that needs to be addressed, and also to really call for strengthening municipalities to deal with climate shocks, but not just responding to climate shocks, but building local government that can be or infrastructure as well that can be resilient to climate shocks, because there has been an increasing frequency of extreme weather events. We've seen in Mthatha, there's been the devastating floods, and we really need to protect education and healthcare facilities in that context. So the last area that I'll speak to is around public participation, which is that South Africa does really well in terms of our budget transparency at a national level, which we welcome, but we really think this will be hollow if there isn't sufficient public participation. Yes, this year, the 3 budget cycles were quite an expensive exercise in that, but I think that should be a lesson, not just for political gains or political scoring, but really to look at how we can actually democratize the budget and bring the budget to be shaped by intended beneficiaries in the country. And so we're calling on this committee to also deepen public participation and to formalize engagement across the full budget cycle. So even at the creation or the inception of the budget, there should be the contributions or perspectives of the people who use public healthcare facilities, public schools, etc. So yeah, thank you very much once again for this. I will stop right there and happy to answer any questions. Thank you very much.
Thanks, Tidi, for the presentation. Equal Education and Equal Education Law Center, you're invited to give us your presentation.
Thank you so much, Chair. If you can just advise if the presentation is visible.
It is visible. You may continue.
Thank you so much, Chair. If I can just have a second. Thank you so much, Honorable Chairperson, and honorable members, as well as all participants in this specific session. I think for the purpose of those who perhaps are not familiar with Equal Education and the Equal Education Law Center, an introduction would do us well. In terms of equal education, and I must indicate that I am Sam Bainon. I'm a researcher based at Equal Education. We essentially are a youth-led mass democratic social movement, and we have about 6,000 members, mostly comprised of learners in the education system, but also post-school youth, parents, teachers, and community members who use mobilization, and public action, which of course is supported by careful research to empower young activists in the fight for equal and quality education in our country. Many of our advocacy campaigns are actually informed by the everyday lived experiences of our members, in particular learners in schools across the 5 provinces that we exist in, which is the Eastern Cape, the Western Cape, KZN, Gauteng, and Limpopo. And our advocacy campaigns, of course, are also informed by careful policy analysis. In terms of the EELC, it is a public interest law center specializing in education law, specifically community lawyering, movement lawyering, and legal research and advocacy. And the EELC works quite closely together with ourselves at EE in pursuit of this common agenda around advocating for an equal education system and quality education for all. In terms of our presentation, Chairperson, our submission seeks to highlight the social impact of the state's budget, and we of course primarily focus on the education and ECD sector. We start off the oral submission, which I must also mention, Chair, is accompanied by a written submission which we made, which of course unpacks part of our aspects of our oral submission in detail. But we start out this oral submission by looking at the legislature fiscal oversight and the importance thereof, right? Parliament's constitutional mandate to oversee the national budget, in our view and our analysis, has remained unfulfilled for almost 3 decades. And while we acknowledge that the Constitution grants legislators substantial powers to amend money bills, we feel that these powers have been systematically underutilized. And this creates a democratic deficit where public participation in fiscal decision-making has essentially been sidelined. And you might ask, well, what is the implication of this, or how do we noticeably see this, right? We see it in legally mandated programs that continue to remain unfunded, like in the question of now compulsory grade R. We see it in how constitutional rights, in particular, in our case, those of learners, continue to be compromised through budget constraints. And we also see it in how Treasury effectively overrides legislative decisions through fiscal policy. And so for us, this represents more than just a procedural concern. It actually constitutes a fundamental breakdown in democratic governance, and the separation of powers. I think in the context of South Africa's first coalition government, which is now in place, we feel that Parliament faces both an unprecedented opportunity and constitutional obligation. And the deeply entrenched historic practice of treating budgets as, these foregone kind of conclusions, we feel has left our legislative framework for fiscal oversight largely untested and incomplete. And we urge members of this committee and other honorable members to navigate this untested terrain carefully, but decisively. We want to emphasize that budget choices essentially are political choices. And the burden must never be placed on the most historically marginalized communities for which the instrument in the form of the budget is meant to serve. The absence of established procedures doesn't necessarily diminish Parliament's constitutional duty to intervene when budgetary provisions potentially violate legal mandates. We want to emphasize that constitutional duty to intervene does still remain. And against that background, honorable members, and of course with the utmost of respect, we want to emphasize that political parties had manifestos that they presented to the electorate pre-May 2024, and as one or two institutes, a part of a collective of many, as mentioned by the Budget Justice Coalition, and other stakeholders in society, in particular, for example, in our case, learners who continue to advocate around the question and demand access to equal quality education. We will continue to monitor how honorable members use their positions of authority and power and their ability to conduct oversight in fulfilling the promises that they made, particularly in our case around the question of education and early childhood development. On that note, Chair, we want to emphasize in this oral submission the question around what meaningful public participation actually looks like and feels like. The Constitutional Court has affirmed that public participation must be meaningful, so it cannot continue to be a tick box exercise. And what does meaningful mean, at least in the legal sense? Well, it means with a reasonable opportunity capable of influencing the decision to be taken. And so as EE and the ELC, we continue to encourage examining different models. And the example that we've used is that of Malawi's 2025 youth pre-budget consultation, where concrete proposals were incorporated into budget planning. We also recommend the following. We recommend early stage engagement. Members of the committee, amongst others, must establish pre-budget consultations during the formulation phase when public input can genuinely influence decisions. We also promote or advocate for budget accessibility and believe that materials must be easily accessible. that highlight the impacts of the national budget and must be written and presented in a way that are understandable for all to comprehend and apply their minds around before consultation sessions. We believe that formal channels explaining how public input influence final decisions to close the participation feedback loop should be created. And of course, at EE and the ELC, we promote inclusive participation. We believe that specific consultations must be targeted for groups most affected by budget decisions, including young people, women, people living in rural communities, and just generally speaking, historically marginalized populations. Honorable Chair, in terms of consolidated education spending, we note that while nominal spending on basic education is set to increase by 6.7% this year and at an average rate of 5.65% over the MTF period, the reality is that real spending per learner adjusted for inflation in the education sector specifically actually reveals the opposite trend. And we want to emphasize this truth and this reality because it's important in terms of how analysis from NT's perspective in particular is actually presented to us as civil society and members of the public. And so this is why we actually reveal in this oral submission this opposite trend and highlight it. The declining share of education as a percentage of the total government spending, which is indicated by the yellow line in the graph, reveals that this is not, in fact, due to rising teacher costs, a narrative that we continue to see perpetuated, but rather a deliberate policy choice to continue to deprioritize education funding over time. And the question is why? And the question also, I think, should be who then is impacted the most. We know, Honorable Chair, that in reality that for so long as we continue to deprioritize education funding over time, is the Black child residing in a township, residing in a rural community, the Black girl child, the Black girl child with a disability, because we're an intersectional civil society organization amongst many who have participated in the session. We want to emphasize that this just can't be. And it is a choice that is made, and it's a choice that ought to be challenged by members in this committee, amongst others. A specific provisional allocation to protect frontline posts has been reduced by 9.5 billion in this year's May budget relative to March, and we note that. We also want to, in our oral submission, Chair, with the utmost respect, highlight the challenge of spending inequitably. And this reflects budget choices and decisions that ought to, in fact, be equitable and just, but in reality continue not to be. South Africa spends more on teacher wages in fee-paying schools than it does in no-fee-paying schools. There are also issues with the post-provision formula, in that not enough allocation is made for redress, rurality incentives, and attracting some of the most quality teachers to some of our most marginalized areas and schools. And many of those teachers exist, and we advocate for resource allocation for those teachers to be placed in areas where they are needed the most. We also highlight how there are issues with data and the quintile system. And for the purposes of a more detailed explanation, we encourage honorable members to engage the written submission accompanied by this oral one. In terms of the PES, the education component of the PES formula still relies on learner population estimates without waiting for poverty levels, rural factors, and other resource backlogs. The PES also does not account for different resource costs between provinces, even though we know the reality in provinces is vastly different. Skills infrastructure and economic scarcities drive up the costs of service delivery in our rural provinces especially. This results in poorer provinces experiencing worse learning environments, and therefore the inequality question in the education sector continues to be perpetuated. It is particularly evident in the wage bill. Richer provinces can dedicate a smaller share of their budget to staff while keeping learner education ratios below the national average. But poorer provinces cannot afford to lose more teachers, but they have less money left to spend elsewhere. And while we acknowledge the slight real increase in the 2025-26 allocation, we want to emphasize that this modest improvement fails to compensate for years of austerity and severe underfunding. The Constitution actually requires DORA to take into account economic disparities within and among the provinces and ensure provinces are able to provide basic services and perform functions allocated to them, as well as meet obligations of provinces in terms of national legislation. And we continue to look at the question of funding for Stats SA in relation to data production. We continue to, in this oral submission and written submission, look at the question of unfilled posts and what this then means. What is the direct implication for our everyday learners in the form of school overcrowding, which we do acknowledge is a multifaceted issue affected by an array of inputs, including school infrastructure, furniture, scholar transport, language and admission policies, and the training and placement of educators. And austerity-stricken provincial budgets just do not offer remedies to this problem. For the purposes of time, we also want to highlight the issue which I had previously touched on, the question of unfunded mandates. And while they might not necessarily or arguably in some corners be unlawful, the reality is that the implications, like in the case of the grade R unfunded mandate, means that, like in this case, the issue would be concerning because grade R, as it currently is defined, is part of basic education and represents an immediately realizable constitutional right that children ought to access right now and not sometime in the near future. And so I think our call then to members of the committee is to hold NT accountable for this and be then, if in position itself in a way then to be able to offer explanations and justifications to members of the public around why funding remains not to be allocated to this mandate. In terms of ECD, we acknowledge that there has been strides. The table budgeted makes a provisional allocation of approximately 9.9 billion for the national ECD subsidy over the MTEF period, potentially increasing coverage by 700,000 additional children and restoring the subsidy to its 2019 value of 24 Rand, from the current frozen rate of 17 Rand. So we acknowledge this, and while this increase is welcome, we want to still emphasize that it falls significantly short of meeting children's constitutional rights. And we give an example there of modeling that indicates that even the minimum adequate subsidy would be approximately between 38 Rand in 2025 and 49 Rand by 2030, roughly double what Treasury proposes. We also want to highlight that since this is the only provisional allocation without clarity on conditions or timelines, the committee's oversight is crucial to establish fulfillment requirements and prevent the funding from being lost in subsequent political negotiations. While an important step towards addressing the subsidy erosion, this allocation still falls far short of adequately fulfilling children's ECD rights, which have been severely underfunded since before 2019. As I head towards the close, in this oral submission, we want to continue to highlight the question around school infrastructure, and there are a number of inputs we make. We cite how, despite extensive infrastructure backlogs and Parliament's directives, the bill will cut real spending allocations to education infrastructure. Present spending levels continue to be too low to allow schools to meet the minimum uniform norms and standards for public school infrastructure in the future. And because these many levels do not allow schools to meet maintenance requirements, there will be a significant degree of wastage. And this will actually drive up costs in the future. We also want to emphasize the announcement to end the Community Library Services conditional grant will further jeopardize learners' access to libraries as mandated by the minimum uniform norms and standards for public school infrastructure. And honorable members, we highlight all of this because the reality is that together with other learner-teacher support material, the National School Nutrition Program, scholar transport, school furniture, all these tools require sufficient resource allocation to enable the quality education experience our most marginalized learners deserve and have a constitutional right to. The second last point would look at the continued sadly and deeply regrettable trend around financial mismanagement and corruption in the sector. Excuse me. And we propose that colleagues engage the submission in that regard. More importantly, what are our recommendations as I move to close in the last 2 to 3 minutes? I had mentioned our recommendations early in the oral submission around public participation and how it ought to be meaningful. I think on the equitable distribution of revenue to provinces, we propose that the committee move to advocate that there be an increase in the PES to reverse the persistent decline in real education funding, the implementation of the revised education component formula that better weights learners from poorer backgrounds to address that question around inequitable spending be expedited, publish the updated formula details to enable public comment for greater transparency and accountability. Closely scrutinize, the adequacy of funding to Stats SA to ensure timely collection of income and expenditure survey data needed for evidence-based policy decisions. On the left, you will see our recommendation around how we advocate for meaningful public participation, something I had expanded on quite deeply at the beginning of the oral submission. On expenditure pressures and unfunded mandates, provide dedicated funding for the implementation of compulsory grade R as mandated by the Bella Act. Ensure provincial education budgets can adequately address critical teacher shortages and reduce classroom overcrowding. Introduce the conditional grant for scholar transport, allocate targeted funding to address the national furniture shortage of 2 million desks and chairs. It just can't be, honorable members, in 2025 that learners have to still experience this on a day-to-day basis. Fund the filling of critical vacancies in provincial education departments to improve service delivery, ring-fence funding for textbooks and learning materials to prevent shortages. And then we also just lastly raise a number of recommendations around the different conditional grants, which we're happy to take questions on at the end of the session, or also engage with honorable members even after the session. There are contact details. We work in a very collaborative style. And so if honorable members at any point would want to engage us around our analysis and around both our oral and written submission, we welcome that. Ours is to continue to advocate for resource allocation so that we can realize the right of access to quality education for all children in South Africa, but in particular, the most marginalized children. Thank you very much, Honorable Chair.
Thank you very much. That was quite a lengthy but informative and detailed presentation. We welcome it. Let me now award this opportunity to Institute for Race Relations, Legal, and PC. You're most welcome to make a presentation.
Thank you, Chair. Greetings. Let me bring up my slides. I'm not sure that I have sharing permission.
Yes, Gabriel, you do have the sharing rights.
Okay, great. Thank you very much. Sorry, 1 second. Okay. Let's kick it off. So yeah, thank you for yet another opportunity to discuss South Africa's annual fiscal legislation in a revised form this year. I represent IRR Legal. I think that the committee members may be familiar, as we've made presentations before, but yeah, our mandate is to vindicate the right enshrined of the Bill of Rights and to take South Africa from being home of probably the world's worst unemployment rate in the world in peacetime to a republic that works. And it's with that in mind that we welcome this opportunity to submit our position. What I'm going to talk about, I'm quickly going to talk about what BEE premiums are again. Then I'm going to go over our core recommendations vis-a-vis BEE premiums in the Division of Revenue Bill and the Appropriations Bill. I will be focusing on the Appropriations Bill. Last time I focused. I'll talk about the BEE exclusionary rule in the Appropriations Bill, and then get into the trade-off between BEE premiums and value for money. We have some specific amendments recommended in the Appropriations Bill and the Division of Revenue Bill. Although I should say those have been detailed in our written submissions. But the headline that I want to underscore here is that we are really excited. We're very encouraged by particularly the current version of the Appropriations Bill. We think it's a great historic moment in South Africa for this committee to be faced with a bill which, for the first time, I think in a very knowing and conscious way, really brings BEE premiums in public procurement, at least in 82 billion rands worth of public procurement covered in Schedules 1 and 2 of the Appropriations Bill down to 0 rand. And I think that could really set an example for the rest of the fiscal system going forward. So yeah, it's great. We think that this bill's, the Appropriations Bill's draft form is really strong on this point, and we want to encourage that. So what is a BEE premium? I think everyone knows. The triple PFA sets the cap for BEE premiums in procurement at 25% for contracts under 50 million rand and 11.1% for larger contracts. Treasury official Willie Matambula says some people prefer to call them preference premiums, other people prefer to call them BEE premiums. Happy either way. So we members want to call them preference premiums, that's fine. It's all speaking to the same idea of spending more for getting less in order to achieve some other policy goal to do with the race or other identity groups of the supply chain. And I think the rest of the points are fully understandable. We thought this time, we referred to this previously, but we didn't actually show this table from the late Stephen Mechero's study of BEE premiums This is, as far as we know, the only case where Treasury ever publicly published how much was being spent on premiums. This was in 2006-07, so that's not good. It's been a long time since then, nearly 20 years. But, you know, this table gives the committee a chance to see what it looks like, you know, within a particular department, within a particular organ of state. These numbers aren't very large, in absolute terms, 11 million rand and so on. But if you sort of look over the whole 1.2 trillion rand in public expenditure, it really adds up. Here, the premiums average at 20%. We think that's probably going to be quite a bit higher than the listed premiums that have been spent subsequently, as a result of our engagements with over a dozen procurement organs of state. But still, they're considerable. Anyway, there you have some of a chance to see what it looks like. So in education, you spend X amount, and some of that's for education, but some of that's just extra to sort of prefer this business rather than that business. And that can be for textbooks or for infrastructure or for laptops or for whatever. So some kids don't get laptops or don't get textbooks or don't get laboratory equipment because the decision was made that they're not really as important as playing a social engineering exercise out through the procurement mechanism. And so, yeah, our core recommendations are effectively to alter that. Let me get through to how we think that's already being done by the Appropriations Bill, because we think that's the good news, and we want to emphasize the good news today. So this is the way that it works in the Appropriations Bill. Whenever a main division in Schedules 1 or 2 includes appropriation amounts for goods and services, that's procurement, which happens under the transfers and subsidies. That automatically means that no BE premium can be withdrawn from the National Revenue Fund. And the first reason for that is the Constitution, Section 213(2), which says money may be withdrawn from the National Revenue Fund only, and the terms are provided. The committee will be familiar with them, but basically it says only, we'll revisit this later, only through explicit mention in this legislation, the legislation that is earmarked as the Appropriation Bill, or through a special mechanism which isn't really relevant to all of this. That's the first reason, that the money can only be done if it's explicitly done like this. The second reason is that sections 215, 16, and 17 all say that transparency is a necessary element of both the annual budgeting process and of the procurement process. So it has to be transparent where the money is going for BE premiums, where's it coming from. And then the third reason is that the Appropriation Bill itself, this version, defines subsidy in terms of the 2009 guidelines on economic reporting, which in turn define a subsidy and a transfer in terms of the requited, unrequited distinction. And the committee will be familiar with this, but just to refresh everyone's minds, a requited payment is one where the government directly gets something in return for the money that it pays. An unrequited payment is one where the government is serving the public good or a public interest, but it doesn't directly get anything in return. So if the government subsidizes buses, or the government spends money subsidizing land reform, rural development, it's paying money to what it thinks is good, but it's not. So it's getting something back in the big picture sense of the whole country getting better, hopefully, if the money's being well spent, not being wasted, bribery and corruption. But it's not getting anything directly back. And that's exactly how BE premiums work. That extra which is paid on the BE premium is supposed to serve a public interest or the public good in the minds of the legislators who allow for BE premiums through the PPPFA and the administrators who enact it. But the government doesn't get anything back for the premium that's the whole point. The premium is the bit that is paid extra, where the good that's coming out of it is a public good or a public interest, but is not a particular good or service in the sense that procurement speaks to in terms of requited, unrequited returns. So BEE premiums are subsidies. Very clearly, I think
if it's me, Mr. Nodada, or is Gabriel that got cut off? You may continue, Gabriel. I think there was some problem there. Kindly start on the same slide so that we can be on par with what you were explaining.
Okay, thank you. Should I start from the? I'll go from just the last point that I was making, which is that. Thank you, Chair. So the last point that I was making there is that the appropriation bill defined subsidies in terms of the 2009 guidelines, and the 2009 guidelines define subsidies in terms of the required and unrequited distinction in such a fashion that BEE premiums are subsidies. And so to return to the top line idea of the slide, that means if no allocation is made for transfers and subsidies for a particular line item, that means no allocation is made for the payment of BEE premiums in that line item. So we've taken an example that we've screenshot from the current version of the Appropriations Bill, which we really like. So this is right at the top, the presidency, and you can see we've underlined executive support and policy research services line items on goods and services. So the goods and services, that's where procurement is happening. It's not compensation of employees, which is a different story. Talking about procurement that would happen under the PPPFA. But you see that while there's 35 million roughly allocated to executive support and roughly 4 million for policy and research services and procurement, there's nothing for transfers and subsidies there. So that means there's no allocation in the Appropriations Bill that can possibly legally go to BEE premiums in those line items. The line items above, in theory, that 580,000, some of that could go to BEE premiums. But where there's no transfer and subsidy, very clearly there can be no BEE premium because that is a subsidy, and allocations can only be made again in terms of 213(2) of the Constitution when they're done in an explicit fashion through the legislation. So we've highlighted for the committee's benefit a series of instances where that mechanism is used, that exclusion rule is used within the Appropriations Bill to bring down BEE premiums to R0. And so that's already a good start. But then it gets much, much better. And here's where we're very, very excited. So we've engaged with various officials in organs of state and in Treasury, and we've gotten the following understanding of things, which we want to relate. It's actually purely commonsensical and based on the text. And it's the following. If we look at the land reform and restitution allocation, we see that there's 708 million allocated for procurement of goods and services. And then we see there's 3.9 billion in transfers and subsidies. So in theory, what could happen is that some of that 3.9 billion could go to paying for BEE premiums in the 708, on top of the 708 million. So let's assume, following Michiro's study, that 20% premiums are added on top of the 708 million in procurement. That would not be able to come out of the 708 million in procurement because that's procurement of goods and services. It's not a subsidy. It would have to come out of the subsidy section. And that subsidy section 3.9, that allocation, 3.9 billion, is large enough that you could easily get 20% of the 708 million out of it and add it on top. And then you could do procurement through the triple PFA in the usual way. However, what we've come to understand, and which to relate to the committee, is that 3.9 billion, really 3,927,514,000, is actually all already accounted for without BEE premiums. And what it's accounted for by is precisely the line items further enumerated. For example, restitution grants, land reform grants, and so on. So all of that money's already got something to do. There's none of it left over to pay for BEE premiums. So it'd be unlawful if any of that money was taken away from land reform grant beneficiaries in order to pay some company an extra 20% for supplying legal services, for example, to the department. And that means that there's this other mechanism where BEE premiums are ruled out, and that is where the budget is allocated for procurement, 709 million, and the budget is allocated for subsidies and transfers, 3.9 billion. But the entire subsidy allocation is exhausted without any BEE premiums being accounted for. Under that mechanism, there's no room for BEE premiums to come in. They can't come in as goods and services because that's not what they are. And they can't come in the subsidy and transfer allocation because that's already been accounted for. And we understand, we relate to the committee, that every single subsidy in Schedules 1 and 2 is already accounted for without BEE premiums. And so that means that the appropriation bill, using both Mechanism 1 and Mechanism 2, rules out all BEE premiums. So that's not for the entire country, national government, or provincial or municipal. There are other ways that BEE premiums can get in. But over the 82 billion in procurement covered by the appropriations bill, BEE premiums have been reduced to zero. And we think that's great news, and we urge the committee to go forward on that basis. One of the reasons that we think that's great news is that the Zondo report recommended in spirit to reduce BEE premiums to R0. It weighed up the tension, as it described it, the inevitable tension between what we're calling BEE premiums, what it called the transformative potential realized by the legislation earmarked under Section 217(2) of the Constitution and required by 217(3). The inevitable tension between that and the imperative to achieve maximum value for money, which was the Zondo report's abbreviation for the requirements of Section 217(1) of the Constitution, also meant to be implemented by the triple PFA. And the inevitable tension has created confusion, which has facilitated corruption, according to the Zondo report. And it said we need to get clear and transparent about this, and we need to decide which one is more important, transformative potential or maximum value for money. And it said, and I quote, ultimately, in the view of the Commission, the primary national interest is best served when the government derives the maximum value for money in the procurement process, and procurement officials should be so advised. So we bring that spirit of advice to the committee. We say, well, look, the appropriations bill is actually going a step further and not just advising procurement officials, but obliging procurement officials to cut out BEE premiums to R0, at least for the line items enumerated in Schedules 1 and 2 of the appropriation bill. This is also in sync with Treasury's imperative. Came earlier in the budget review. It said, like, we've got this big problem, we can't make ends meet, no economic growth for 15 years, what are we going to do? Hard to raise taxes, the VAT tax raise didn't work, there's no other tax raise that's going to work, they're all going to pass the Laffer curve. And we can't raise debt, we're already junk status, so what can we do? Well, we can maximize value for money. And reducing BEE premiums is precisely that, maximizing value for money. So that's really in sync with what Treasury's asked for. We think that's maybe why they've tabled it in this version, encouraged Parliament to vote it through in this version, cut off those BE premiums. It's also really popular. The Institute of Race Relations commissioned a poll, demographically representative last year, asking, how would you, ordinary South Africans, like to see the budget allocated? And three options were given. One is value for money only, no race. One is value for money primarily. Clearly, that's the first decider. But if there's a tie between a white company and a black company, then the black company gets the contract. So race is used as a tiebreaker in preference of black-owned companies or black-managed companies. And then the third option is where, no, you pay extra to incentivize BE accredited companies. And 23% of respondents, 24%, let's say a quarter, 25%, did say it's worth paying extra, as the government has done for decades. But roughly 75% said, no, we want value for money, thank you very much. And then some of those wanted value for money only, and some of them wanted value for money and race as a tiebreaker. But that is not a policy question for this committee. That would be addressed further down the line. The point is that where this committee oversees the appropriation bill, insofar as that function goes, is producing value for money by reducing BE premiums, and that's what most people want. And in fact, that's also true if we drill down just to black respondents, where 30% of black respondents said BE premiums are worth paying, and over two-thirds, just on two-thirds of black respondents said, no, we want value for money. And I think that probably has something to do with the fact that because of the legacy of apartheid, most disadvantaged people are black. And so, when they're let down by an inefficient procurement system, inefficient service delivery, a stultifying no-growth economy, they're not really benefiting from BEE, and so they want something better, which is value for money. I think that's at least part of it. But we redid that polling question this year during the budget crisis, and the numbers really climbed up. I think as people saw how severe the budget crisis really is, support for BEE premiums went down to 16%. It's a tiny fraction of very hardened ideologues, I think, that bittered, very disappointed with the way the system works. But the overwhelming majority, well over 3/4, said we want value for money. And again, the numbers went up when we just drilled down to black respondents, with 22% saying preference for BEE premiums, and over 3/4 saying cut out the BEE premiums. And so, that's why it's really great that the Appropriations Bill does cut out the BEE premiums or brings them down to nil. I also want to just quickly, note that the IMF has repeatedly, has severally detailed how the preferential procurement system is costly and ineffective, how it facilitates corruption, state capture, and rent seeking. So it's not like has nothing to do with the race of people involved. A lot of white people have benefited from illegally and otherwise from the preferential procurement system. Many are well known. It's just about when the system is confusing, then it allows rent seekers to get in there, and that's what this preferential system does. So bringing down the premiums is a good idea. Harvard Growth Lab last year encouraged the relaxation of preferential procurement requirements, all public entities. And so, it's great. This committee is finally heeding that internationally renowned advice by reducing BEE premiums to zero, and that's really, really good. Another way to look at why this is important is that the fiscal multiplier was found in a paper first published in draft form by the South African Reserve Bank, and then given the peer review process, has found that the fiscal multiplier in South Africa turned negative. That means, all these people who complain about austerity budgets are right. I mean, there's something very sad about how little ordinary South Africans manage to get out of government spending. The problem is the more the government spends, the smaller the economy becomes. And that's, almost unheard of in the world. Usually fiscal multipliers, if it's really good, it'll be above 1 rand. That means you spend R1 and you get like 1.5 rands worth of value out of it. And that's how things were in 2010, according to the numbers, on the back of the Mandela and Mbeki administrations. I think good work in expanding needs-based policy in many instances. But things took a very, very bad turn. And that is due to policy, as the Zondo report analyzed, as the IMF analyzed, as the Harvard Growth Project analyzed. It's too easy to get into this personality game of blaming this person or this party or that party. This is a government issue, and the government has failed. The civil service has failed to spend money properly. That is because of the rules being so difficult and cumbersome and confusing that corrupt actors of all sorts could infiltrate and insinuate themselves and take over. We have a second fiscal multiplier analysis there on the right, which also shows this, period where it was getting better, and then this period where it got really bad. And you have this astonishing thing where when the government spends the final rand, it literally is worse than setting it on fire because of how unstable and destabilizing the corruption is that rand, as it were, goes through in its journey from the taxpayer's pocket into the pocket of some corrupt private or public person. That all is just one side of the coin, which is represented in this graph, which is the last graph that I'll show you. And that side of the coin is the green line, which is based on the Worldwide Governance Indicators report put out every year by the World Bank. And that shows how effective is government spending. And we baselined it to 100, and you can see the journey from 96 down to 2022. And there were some upturns. There was definitely some good news there, but it came down, and that's because of a policy that this committee is directly connected to, which is like the policy of transparency, accountability, cost management in the allocation of public funds. And that there's been so little transparency. I mean, no one has ever bothered to publish outside of that one study by Mahero how much BEE premiums are spent on. That just shows from the very top, like how unconcerned, unfortunately, Parliament has been and the executive has been in being transparent about what's really going on here. And the effect of that has been, again, just to allow all kinds of corrupt actors to run amok with the annual procurement expenditure of around 1.2 trillion. And that means that even though you're spending more money, you're getting less and less effectiveness out of it, as ranked against a basket of about 180 countries. And then the right line looks at the more money side, which is, revenue relative to GDP. I think that there are a few measures, inflation indexed and so on, but really the big question is like how much revenue is coming out of GDP. And this is not the place to try and change the revenue situation. The revenue is here, and this is about dividing it and allocating it. So I just want to contextualize why we're looking at this. It's just to show the committee that, as the government has been taking more and more money out of the economy, it's been spending worse and worse. And that goes some way to explaining why we haven't had any economic growth per person in 15 years. Absent that growth, we can't lift people out of poverty, and we sit with the world's worst unemployment rate, which again is like the primary issue that we want to try and address. So the Appropriations Bill does this really good job. The mechanism of reducing BEE premiums, the mechanism 232 again, is that money may only be withdrawn in terms of an appropriation by an act of Parliament or as a direct charge against the National Revenue Fund when that's provided for. And so by not providing for the withdrawal of funds to pay for BEE premiums, the Appropriation Bill reduces BEE premiums to R0, and that's really good news. That also highlights a risk, though, which is that maybe efforts are going to be made to pay BEE premiums from this allocation, even though there's been no allocation made. And that would violate 215.1 requirement of transparency, 216.1 requirements of transparency and expenditure control, and 217.1 requirements of transparency in public procurement. So we really encourage the committee if the bill does get voted through in this form that reduces BEE premiums to R0, to keep a close eye on whether the will of the legislator is actually being done in reducing BEE premiums to R0 in these scheduled allotments. There is relevance to the Division of Revenue Bill 2. That is detailed in our submission. I think the main thing that I just want to highlight for the committee is that if you consider the way that the Division of Revenue Bill and the Appropriations Bill currently are, there's potentially a tension there, where the Division of Revenue Bill might be considered to still allow for some BEE premiums and the Appropriations Bill doesn't. And so we would just urge the committee to look at the recommendations that we've made, which would just make it explicit. But I think it's actually already implicit in the Division of Revenue Bill that there's no room for BEE premiums there either. But if the IR legal suggestions are made of just a couple of small amendments, then that would be made explicit. And we think that would be really good, especially if there's legal action coming down the line in terms of organs of state trying to abuse the system in spending BEE premiums, even where no allocation has been made by the Appropriations Bill. And that's something that obviously everyone wants to avoid. So let me just go over the core recommendations one more time, and that'll conclude this presentation. The first is keep the Appropriations Bill Schedules 1 and 2 and the subsidy definition as they are, since that reduces BEE premiums to R0. Second is to make the premiums transparent where they are spent elsewhere through amendments to the Division of Revenue Bill in particular. Furthermore, reduce BEE premiums to R0 in a broader set than just the 82 billion through amendments to the Division of Revenue Bill as recommended in our written submission. Furthermore, please provide clarity. I think what's going to be really important is to provide clarity on the relation between the Appropriations Bill, reduction of BEE premiums, and the Triple PFA. Because the Triple PFA says that you can get exemptions from paying BEE premiums through application to the minister. So we assume that since the minister's effectively tabled this bill that reduces BEE premiums, the minister will say yes to all of those exemption applications that come. But the question is, do the exemption applications actually have to come? Or has this bill, if it's passed, already meant to play the role of showing the minister's interest in reducing, in granting those exemptions? In other words, would they just be pro forma wastes of paper? We're not exactly sure about what the thinking is there. So in Treasury's response, we encourage it to provide clarity on that question. And I think this committee also, insofar as it wants a cohesive whole from a legislative perspective, is going to want to attend to making sure that everything's in harmony properly there. We also request clarity on the zero budget allocation for the Public Procurement Act incoming cost effectiveness criteria that must come into place under Section 240.24.1d of the Public Procurement Act. And basically the issue there is, I think at our suggestion, Parliament amended the Public Procurement Act to include this requirement that cost effectiveness must be evaluated for every procurement systemically once the PPA comes into place. But that's going to be very expensive because of the because of the new BEE premium system that requires. And so our understanding is that by not allotting the Division of Revenue Bill and the Appropriations Bill as they are make no room for that to come in. And so in effect, they kind of lock out the PPA from coming into place until at least the next budget cycle, March next year. On clarity on that. And finally, I think I've gone into a bit of detail, legalese, but let's zoom out for 1 second. What's the good thing about cutting out the BEE premiums as the Appropriation Bill does? Well, if you also do it in the Division of Revenue Bill and you get the maximum yield of the Zondo dividend by implementing the Zondo report's advice, that's estimated to be 150 billion rand. And that could be used to build 65,000 classrooms and reduce the debt concurrently. And we think that will go profoundly long way to helping the most vulnerable South Africans stand a better chance and improving this Rainbow Republic's future in a way that can't be matched. It would really be a radical form of transformation for the good. Thank you for your time.
Thank you very much, Gabriel. Let me now invite Kwasatu to make their presentation.
Morning, Chair, morning, members. Just uploaded quickly, but just to thank members for giving us space just to share our views on the three bills. We cover the Division Revenue Bill, but also the Appropriation and the Public Sector Pension and Related Payments Bills, Chair. I think, Chair, just from our side as a Labour Federation, we'd obviously kind of ground our expectations and our view about how the budget should be used based upon our socio-economic crises. We've been sitting, Chair, for the past decade plus at 1% economic growth each year, far below the 3% we need to generate to reduce unemployment. At best, in the MTEF, we hope for 1.6% growth. Yet, Chair, we've seen in this year, just in the 3 months since Budget 1 and Budget 3 were tabled, unemployment has increased by about 1.5% to 43.1%. Youth unemployment is an absolute crisis. And of course, I think we all know, Chair, the entrenched levels of poverty, of inequality, of crime, of corruption, the rising cost of living, our really kind of aging infrastructure and our struggling public and municipal services, SOEs, etc. And so it does feed into, Chair, a bit of a general sense of hopelessness, of despair, whilst acknowledging that on many fronts we are beginning to turn the corner in rebuilding the state after the decade of state capture, etc. Chair, I think for us, we had garnered a bit of hope when the Minister for Finance spoke about a need to move away from austerity budget cuts, which have really had a huge impact upon public services that working class communities, the economy depend upon. We had hoped to see interventions to stabilize, to rebuild public services, municipalities, and of course, economic investments to help grow the economy, especially on industrial sectors. And whilst we do these things, Chair, we also had hoped to see, protection for the poor, for the unemployed, and of course, to give more support to SARS to deal with the issue of tax evasion, so that the fiscus has the money that it requires to fund government's constitutional mandate. Chair, I won't go into the revenue issue too much because obviously that falls under the fiscal framework, but just for members' benefit, our views on the VAT and the PIT and the fuel tax hikes and non-hikes, etc. And again, Chair, just some for members' background information, some of our views or proposals around the revenue options too. We won't go into that. But Chair, I just wanted to raise one issue around revenue. Because look, obviously a fiscus, a budget is about the division of revenue and the appropriation bills are about rands and cents. And if you don't raise money here, where do you raise it to fund the different projects we want to see government funding? And we do think there is a need to have engagements on where do we help generate money for the state. And we think one option which we really need to ramp up and have a very blunt discussions around the DFIs, be it the Development Bank, the Industrial Development Corporation, the Public Investment Corporation. Are they not able to take on board more of the economic infrastructure investments? For example, Chair, the 13,000 university beds, that's something that the PIC could easily do because they will secure return on investment through it. So you can help actually to increase some amount of investment in infrastructure and the economy whilst lessening the burden upon the state. And similarly, Chair, with the DFIs, the CETAs, the NSF, to take on board more of the public employment program costs and also the skills training program costs. And so I think there is a bit of a shift in that regard, Chair, on the UF allocations this year, which is positive. But we think there is space to do even more on that. And similarly, Chair, we think there's need to have more discussions with the Reserve Bank about the currency reserves account. Can its support for the fiscus continue beyond this year and next year, and to see can it actually even be increased? Again, to really ease a bit on the state and to enable the state to play a more aggressive role in the economy. Chair, on the public services aspects, look, we welcome the public service wage agreement. Is for 3 years. It's going to give some certainty to government to plan for the budget. We think it's a reasonable agreement, and it does give some relief to police officers, to nurses, to teachers who really earn a pittance. And in fact, we know this is always a bit of a political football, but people often say the wage bill is out of control, and in fact, we've seen it decline from 40%, the dollar of democracy, to about 31% currently. In the last 2 years, it declined from 35 to 31%. And yet, Chair, we've seen whilst the population has nearly doubled since 94, from 34 to 64 plus million, the public sector headcount has not really increased. It's actually been stable at 1.2 million. What we're seeing, Chair, right now in many critical departments is the impact of the freeze on vacancies. At Home Affairs, we have long queues. We have a 60% vacancy rate. The police headcount has declined from a decade ago of over nearly 210,000 to about 178,000 today. Similar rising teacher-learner ratios or rising ratios of nurses and doctors to patients, etc. So we do need to shift away from viewing allocation to the state as a burden to actually as an investment in public services, which society, the economy depend upon. There are some positive, Chair, allocations in the Division Revenue Bill and the Appropriation Bills to public and municipal services above inflation. Specifically, there's some useful allocations to education of about 29 billion rand, of health of similar amount. We think this won't resolve all the pressures, but it's a useful step forward. Chair, we are disappointed that between budget 1.0 and 3.0, some of the initial filling of frontline vacancy posts has been decreased. So if doctors decreased from about 1,600 to about 800, very small amount for nurses. Teachers, there is some, but given the pressures of many provincial departments, especially on the contract posts, is not enough. And of course, the police, there is about 4,000, which is welcome. But we also have to weigh that against, an attrition rate as well, which is quite significant. So there's some positive progress there, Chair, but we need to do much more, to be honest. But Chair, we do want to really welcome under the allocations to education, with the Bella Act promulgation, that there's now a move to begin to roll out Grade R, which is going to benefit 700,000 learners. We did really make sure that it happens. It doesn't get kicked down the road. There's some useful allocations for infrastructure for 130 schools. Chair, there's a very important allocation to smart electricity meters rolling out for 2 billion rand. That's critical to help ensure revenues collected for municipalities for Eskom. We do want to welcome the 800 million rand for NHI. And hopefully the intervention for members of the NCOP for Molu to perform will help to address its water crisis. But we are worried about a cut of nearly 3 billion rand for informal settlement upgrades. And that for us is quite worrying, given the real pressures and the growth on that front. Chair, I think, for us it would be useful to have this audit of ghost posts. And when you find them across the state, then make sure we actually fill these vacancies, because it makes no sense to spend money, yet we have a rising ratio of skilled frontline service workers to society. We do think, Chair, there is a need to have some discussion around reintegrating some of the public sector entities back into the public service. You'll find in these entities, Chair, management earning more than what the President of the Republic makes. In public service, you don't have that because you've got a much more fixed and coherent regime. And that can be a useful way to just bring some coherence back to the state. But Chair, when we speak about, tightening the belt, we need to see politicians leading from the front. We think there's a space to reduce on that front. And I think, Chair, also there's a space to reduce what could call luxury expenditure, whether it's traveling, advertising, consultants, catering, etc. Because it doesn't make sense, Chair, to ask working class communities to tighten their belts when on top that message doesn't seem to have dissipated. Chair, I think our greatest aspect of concern on the Division of Revenue Bill, we don't see what's new in the bill with regards to local government. Local government, Chair, I think members will all know, Honorable Ryder will know very well, and other members. It's a horror show. 10% municipalities were in financial distress a decade ago. Today, it's about 70%. We have routinely up to 36 municipalities who struggle to pay staff. We have about 160 municipal pension funds for both workers and councils in arrears. We've seen the municipal debt owed to Eskom doubling to 95 billion rand in the last couple of years. We've seen community debts, I think, is past 300 billion rand owed to municipalities. So we do need to see a much greater capacitation of local government to make sure that they can collect revenue, that they can spend the grants, etc., not just simply return them to the state. But we do fear, Chair, many municipalities were witnessing a complete collapse. And it used to just be an issue of, a Ditsapotla or Mamusa, for example, in rural areas, but we're now seeing many of the metros having really a scary picture. Chair, here are just some of the municipalities which are currently, so 16 in 6 provinces who owe salaries to workers. Some of them, Chair, are regular culprits, like Thembelihle in the Northern Cape, which is your Hopetown area. It's one of the worst offenders. I think at one stage it didn't pay staff for 12 months. The other ones in Free State Northwest, these are regular culprits. Some like Tsabotla, I think, have been under administration 4 times. So there is really a need for a new approach to turn things around. But we can see in some other areas like Eastern Cape, there has been some progress. In some other areas of Northern Cape, we have seen a reduction of corporate municipalities, so we have seen some progress. But I think it remains extremely fragile. But what we would want to, really push is that we give more support to Treasury on the debt collection, whether it's electricity or municipal rates, make sure municipalities are capacitated and given support to collect monies owed, including the offer of assistance Eskom was offered to them. But I think also about a greater capacitation program for them, for the 140 plus municipalities. And I think Chair also to really take up the Minister for Cogta's correct call for a new funding model and a shift towards a district development model, because Chair, we can think on the side, but we're not addressing the fundamental systemic issue. And we need to move whilst we still have the space to move. On the economic stimulus front, Chair, there is some positive allocations, additional 34 billion rand this year, slightly down from the original amount in budget 1.0. But overall, positive trillion rand plus over the MTEF, especially for roads, for water, for rail, for ports, for hospitals, etc. And there is a positive allocation of about 40 billion rand for industrial development, for export sectors, etc. SMEs. But Chair, I think given the lack of economic growth, given the high levels of unemployment, the deindustrialization, 40 billion rand is not going to be enough. We really do need to have a much more aggressive industrial financing program for industrialization, for export sectors, for SMEs. So we need to have that kind of a discussion, and ideally, it needs to mobilize also funds, not just from public sector, but also from the private sector too, because the state will always have limited funds. But also, Chair, I think while the infrastructure program is positive, we need to make sure that municipalities actually spend the money correctly. They do spend it, and of course that law enforcement does deal with the issue of construction mafia, which really has become a huge threat to many construction projects. Chair, just getting towards the end on the relief front, there's positive double inflation indications for increases for social grants. That's positive for 19 million recipients, but we just can't understand why that same progressive commitment couldn't be allocated for the SED grant recipients. There's 8 million of them. It's been 5 years we had the SED grant, and only once in that 5 years has it been adjusted for inflation. So it's facing significant erosion. And to have adjusted for inflation this year would have only been 1.5 billion rand. Surely one could have made a plan on that front. Chair, we do want to welcome the shift, though, around the public employment programs. Those have been cut substantially in the last couple of years, from 36 billion rand to about 3.5 billion rand last year. This positive increases this year for just under 9 billion rand for the presidential employment programs, plus 22 billion rand, which should be released from the UIF to help this as well. The teaching assistants have a bit reduced from previous intakes, but they've started. But that's just for this year, so we hope that will be extended next year and see how we can actually expand these presidential employment programs across other sectors of the state, of the economy, etc. We do worry about a cut of nearly 1 billion rand for the EPWP over the MTEF. But Chair, I think we do need a discussion. We've begun discussion with colleagues in the presidency and treasury, public works, COGTA, and so on, about how do we try to pull together this different public employment programs, whether it's a presidential one or EPWP or CWP or the youth ones. How do you mobilize greater funds? How do you reduce corruption and wastage? How do you ensure better training, skills opportunities, so that when people leave the programs, they actually do find permanent work and they're not kind of stuck in the permanent cycle of moving from employment program to employment program. Then Chair, just lastly on the public sector pensions and related payments bill, I think from our side, this is a straightforward administrative bill. Doesn't have any negative effects upon the public sector, other pension funds. We think Chair does correctly recognize that the state is responsible for all public sector related pension fund payments. So that's a correct premise. And it also does affirm the role of collective bargaining processes where many of these issues are resolved, especially for the GPF with organized labor. So from our side, we don't have any problems with it. So that's our presentation, Chair. Hopefully we did stick to the time payment. Thanks to members for giving us space. Thank you, Chair.
Thank you very much, Kosatu. Honorable members, I am going to take notes that seek to ask for clarity from our presenters and stakeholders. By show of hands, I will start noting hands from members. Honorable Ryder, I see Honorable Ryder, Honorable Majola, Honorable Ndlovu, Honorable Brits, Honorable Swartz, and Honorable Teza. In that order, colleagues, Honorable Ryder.
I'm also, Chairperson, also my hand, you want to be up, unfortunately,
you will be the last, you will be the last, Honorable Numalo. Honorable Ryder, you may go first.
Thank you very much, Chairperson. And good morning, ladies and gentlemen, honorable colleagues. As usual, much appreciation for the presentations, the time that's gone into preparing them, and a professional set of presentations today. We greatly appreciate that. And I think that it's important to note the constructive and positive tone that has been set. Many of the presentations acknowledging the positive changes that have been brought about in the budget, which of course makes it interesting that Equal Education made the point that Parliament's not using its powers to adjust or amend the budget. Many of the other presenters were at great pains to say this is version 3 of the budget, but nonetheless, Chair, I have just brief comments on each presentation. I'll run through them quickly. Let's start with rural health advocacy. A very brief presentation, but impactful, I thought, and I certainly like the idea of using and to have that kind of outreach. Now, I do think that's going to place a little bit of a burden on some schools. Chair, I note my connection is unstable. I'm turning my video off if that's okay. But
it is okay, Honorable Ryder, you may turn it off. And any other member that might follow, if you have, you have a connection problem, kindly just switch off your videos.
Yes, I think the internet is also cold today, Chair. But I do think that the Britain-based schools might have a bit of an issue, and certainly I wouldn't like to see teachers giving health advice. So it may create a situation where a health advisor or a clinic would need to be a clinic personnel, 1 or 2 maybe, I don't know, placed in each school. That's an expensive undertaking, but I think it's something that really is worth considering based on the fact that, young people, when they are still impressionable and can be informed about health issues, and certainly they're there already. It's a safe space, and for them to access health advice at the very least, it's a good place. But not necessarily from teachers. I think let's keep people's talents and skills where their training is. Breadline Africa, yes. Also positives in that presentation, which I enjoyed. The question around ECD registration is an important one that I've grappled with for some time. And it goes back, I think I've mentioned this in one of your previous presentations 2 years ago, but where there was an article that hit home to me quite hard, where it said, don't bring your sentence standards of ECD here to Alexandra. And the issue of trying to find ECD standards for registration, to enable registration, that actually cater to the diversity of our country and the economic diversity that we're faced with, and the fact that it's not necessarily viable to run an ECD in an impoverished area at the same level of care that one would like to see in Sandton. But of course, our children all deserve the same safety and so on. So I think it's quite interesting. I'd love you to comment more on that, Breadline Africa, please. TB Accountability Consortium, thank you. Joint meeting with health suggested and proposed. I think that's progressive, and I think that that was the one thing I took out of that presentation that I quite liked. Section 27 spoke about having stronger oversight of personnel and hiring, which gets into a messy area of political interference in the hiring process. So I think it's quite interesting where to draw the line in terms of that oversight, and it's something that is going to take much deeper thought. I'm not saying we shouldn't be doing oversight over the hiring and the personnel processes, but political interference, I think, is difficult to manage, because we've seen the harm that can cause. Even under the guise of being constructive, there are often agendas and good intentions are manipulated. But your comments about the ghost employees have landed well. I do believe there are good moves on dealing with that in certain parts of government already. I think that your suggestion is well received. Budget Justice Coalition, yes, pointing out less austerity in this budget, but pointing out, yes, two big issues that came out of that is the lack of proper disaster funding, and we've seen the weather issues that have caused havoc in the Eastern Cape recently, but consistently in not only in our coastal provinces, but all around the country, and the need to have that disaster funding in place. And I suppose tied to that is the contingency fund, the contingency reserve, and the fact that this is often used for issues that it really shouldn't be. And in fact, it has been diluted substantially. So good points there as well. Equal education, as I said, you accuse us of not using the powers of budget amendment, but I think that we have evidence to the contrary this time around. Yeah, I also saw my photograph on there. Nice, politicians like to see their faces on pamphlets and so on. And I think, as you pointed out, manifesto was to build more schools. And so I presume with that you are welcoming the fact that the Rapid School Build project in the Western Cape has received a 90% increase in budget, which certainly is good news. IRR, Mr. Cross, public procurement bill, preferential public procurement bill. I think that you made a very strong point that what this essentially does is it is empowering the few at the expense of the many. And certainly, I think I'm on board with you 100%. We want to see less entrepreneurs in Ferraris and more people getting access to good public transport. It's a simple analogy, but I do think that empowering the few at the expense of the many is something that should be front of mind for us as government and as Parliament that has oversight over the work of government, certainly. And then finally on COSATU, yes, drawing the attention of the committee to the problems facing many municipalities. We are, as you indicated, very aware of these, and I do hope that COSATU will have substantial inputs into the discussions as government formulates a new white paper on local government, and that both from government, Labour, and from Parliament side, we can find a solution that ultimately benefits the people of South Africa the most, because ultimately that's what the business of government is all about. Chair, thank you for that. And again, my appreciation to the various presenters.
Thank you, Honorable Ryder, Honorable Majola.
Thank you very much, Madam Chair. Greetings to the members of the Appropriation Committee and all 8 presenters. Madam Chair, concurring with the previous speaker with regards to the quality and the scientific research of the presentation, in particular, Madam Chair, because it ended up with some recommendation that we need to take into consideration. Madam Chair, there were some comments that were general from almost all presenters, which relates to the welcoming of the scrapping of the VAT increase and the substitute of the fuel levy and the concerns around that. Madam Chair, I want to check to the ones that were very strong on it. Section 27, they were very concerned about the impact of it. The budget justice collision, they've went as far as indicating the impact of the consequences of increasing the inequalities. I want to check, Madam Chair, from those two in particular were very strong on it to check. And I think COSATU did mention too, as to whether they do have an alternative with regards to what will petrol levy will contribute in terms of revenue, as to what in terms of their view or their recommendation or their suggestions that we should consider as a substitute. Further, Madam Chair, we appreciate the reminder from the equal education, as the previous speaker indicated. We've been reminded as to what we promised the voters during the elections times. Now it's the time for us to implement what we promised the citizens of South Africa. The last one, Madam Chair, with regards to COSATU, arising from the lengthy background, 1% GDP growth, 43% unemployment. COSATU is always, Madam Chair, concerned about cost employees. I want to check from the COSATU because there is a very little suggestion as a measure of eliminating the risk, as to what COSATU will strongly suggest us will do with regards to eliminate the cost employees. Thank you very much, Madam Chair.
Thank you, Honorable Majola. Honorable Ndlovu.
Thanks, Chairperson, and greetings to yourself, to honorable members on the platform, the committee members, and our stakeholders. Let me also take this opportunity to also welcome the presentation by our stakeholders.
Kindly try to raise your voice, Honorable Ndlovu. You are not clear.
Can you hear me now? Well,
that's better. That's better.
That's better. Okay, thank you. Chair, I think I've got about several questions. I'm not going to go through the slide. I think they know, but I'll try to be brief. To Breadline Africa, on they are page 2 anyway. What key factors contributed to the increase in ECD subsidy to 24 rand per child, and how close is this to actually service delivery costs, and what will be done to close the gap, if any? The other one is what implementation challenges might arise in reaching 700,000 children with the expanded ECD subsidy, and how can these challenges be addressed? Chair, I'll also, the other one, the last one on the Breadline Africa, how well are constitutional and international obligations for children's rights reflected in current proposed budget allocation? Going to Equal Education and Equal Education Law Center. According to your view, What key barriers have prevented Parliament from fully exercising its amendment powers over money bills? That's the first one. And on page 14 to 16, according to your view, what adjustment could be done to the PES formula will better addresses historical provincial inequality? The last one on the equal education is, how did you arrive at the 38 per day ECD subsidy model? And what are the real costs that drive this estimate? Chairperson, let me go to Kosadu. No, before Kosadu, let me go to Budget Justice Coalition. To Budget Justice Coalition, in your view, which areas have Parliament most consistently failed to reflect community needs? That's number one, on page 6 to 8. Two, page 13 to 14. According to your view, what recommendation will you make to ensure this formula update processes is fast-tracked and reflects real provincial needs? Chair, I want to go the last one. Let me go to Kosadu. On page 3 to 4, based on your research, Comrade Parks, how much additional revenue could realistically be generated if wealth taxes on inheritance, estates, luxury goods, and online gambling were adopted? Number two, page 6 to 7, how widespread do you believe the ghost employees problem is? And how systematic solutions could be introduced to eliminate it? Because it's like it's something that is not gonna be fixed recently. Then page 18 to 19, from Kosadu's perspective, what key principles should continue to guide pension reform processes going forward? The last one, Chair, I can see that once you show your face, it means I must finish. What should Parliament demand from National Treasury to prevent backsliding on informal settlement appraisals? Thanks very much, Chairperson, and you are so beautiful. Thank you.
Thank you, Honorable Ndlovu. Colleagues, I must indicate to you, honorable members, that Breadline Africa has requested to leave the meeting around 11 o'clock. They are not with us on the platform, but kindly write your questions and submit them to Mr. Nodada. He'll send them to Breadline Africa and you will be responded to, just to make members aware and not to directly ask questions to Breadline Africa as they are not part of us since 11 o'clock. Honorable Brett.
Thank you, Honorable Chair. Firstly, I commend all presentations made at today's hearing. All these presentations and the continued advocacy for various causes is commendable. And personally, I invite all the presenters further collaboration as we shape future appropriation cycles. Your voices ensure that that lived realities of communities and stakeholders are not lost in the national budget and the appropriation thereof. Now, being the representative of a very vast and mostly rural province, the Eastern Cape, I thank Rural Health Advocacy Project and TB Accountability Consortium for their data-driven presentations on the state of health in rural areas. Your submissions have highlighted critical challenges that our rural communities face on a daily basis, challenges that are well known to this committee, but which require renewed energy and renewed urgency and targeted budgetary responses. From the persistent shortages of skilled health professionals in rural districts to the ongoing infrastructure deficits, to the burden of TB and HIV being disproportionate. It is clear that we cannot speak of universal health access while millions of our rural provinces, or while millions of people in rural provinces remain underserved and current budget allocations underspent or wasted. That should be a huge concern. The call for greater accountability in TB financing and program delivery is very timely. I think a follow-up with the Department of Health and provincial treasuries are necessary to ensure alignment between TB strategy plans and actual budget allocations, especially in provinces with the highest burdens. Equal education, again, highlighted the issue of learner transport, which is also a huge problem and concern from my province. In this regard, the Eastern Cape and other rural areas still have thousands of learners who have no hope of accessing education, basic education, because of a continuing lack of transport. And in many instances, because transport operators are not being paid by provinces. And this situation is dragging on and cannot be tolerated. This issue should be addressed as a matter of urgency. Once again, Kosato, I echo your sentiments regarding local government, in as far as you highlight the need for local municipalities to tighten their belts to account for ghost employees and the lack of financial management. However, what the DDM with district municipalities as pivotal points is concerned, district municipalities face existential crisis across the board. And in this regard, even Salga agreed yesterday. I don't know if a sponsored financial revival would just be another exercise in futility. But surely more deliberation and debate in this regard is necessary, and therefore we should welcome revised white paper on local government as future policy reference document. And once again, thank you for the opportunity and thank you for participating to everybody on the platform. Thank you.
Thank you, Honorable Brits. Honorable Swartz.
Thank you. Good morning, Honorable Chair and all the members and all the presenters. I must say I want to concur with everybody. I'm not going to repeat, but all the presentations, it's brilliant. It's been informative. I've learned a lot of what's happening on the ground. It's packed of data, real from the ground. Somebody mentioned what I've actually also liked is that we need to look maybe in future, more the pre-budget engagement from our stakeholders on our communities. Just a couple of questions for clarity, Chairperson. The Breadline Africa, you raised concern that the current 24 Rand per day ECD subsidy falls short of the required 36 Rand a day for quality care. And the question is, has National Treasury been formally engaged on this costing, and what was their response? And also, can you provide concrete evidence showing how the 24 Rand a day is affecting ECD outcomes in underserved areas? We had a lot of ECDs in our area where I was a mayor, and I know the challenges of ECDs on the ground level. And also what you have also rightly thought, that is the foundation of a good future for our future leaders in started ECDs. And also, what mechanism would you recommend to ensure dedicated conditional grants for ECD infrastructure? And would this fall under DSD or DBE? And also then rural health advocacy project. Given the persistent vacancy rates, what accountability measures would you suggest for provinces that fail to fill funded health posts? And how would you propose Treasury enforces minimum rural health access standards across all our provinces. TB Accountability Consortium, you note the TB crisis continues to be underfunded. The question is, and that is also what really it's our health systems, our ECDs, our infrastructure, and that is what percentage of health conditional grants should be earmarked specifically for TB programs, and how would accountability for spending be ensured? And also, just a question, Vlad, have you observed any provinces that are using HIV conditional grants to successfully co-fund TB work? And should Treasury incentivize this in some of the provinces? Section 27, how would you suggest Treasury and Parliament enforce Section 28 of the Constitution in funding allocation decisions, particularly around child rights and dignity? What sanctions would you support against provinces with repeated infrastructure underspending? And then justice, budget justice coalition. You called for urgent gender responsive budgeting implementation. Which departments are, according to you, are the best placed to lead this, and what minimum budget reform would signal real intent? And then just on the last one from my side, equal education. Your submission criticizes Treasury's delay in revising education funding formulas. The question, what impact has this had on equity across provinces, and how should Parliament accelerate its implementation? And also, can you explain how the lack of ring-fence sanitation infrastructure funding continues to violate learners' right in poor schools? And then just the last one, Chairperson Kusatu. You raised concerns about the public sector pension bill. Do you believe current consultation levels with labor unions are adequate, and what clauses in the bill need urgent amendment? Also, you advocate for expanding the presidential employment stimulus. What costed proposal would you recommend to make this a long-term program, and how should it be funded? And the last one, also, given your emphasis on economic justice, Kusatu, how should Treasury reshape infrastructure spending to create more labor absorbing jobs? Chairperson, that is all from me, and thank you very much once again for all the presentation. It was very informative.
Thank you, Honorable Swart. Honorable Teza.
Thank you very much, Chairperson. I just want to make comments first and then go into the questions. I think that we are quite privy to the position of the EFF on the reject of the austerity orientation that continues to dominate the fiscal framework, and what we are advocating for in terms of massively increasing public investment in healthcare, education, infrastructure, and social protection, to abolish off neoliberal budget ceilings that starve the poor, to appease the credit ratings agencies, the full use of state power to direct the economy through state-led industrialization, land redistribution, and the expansion of public employment. Thus, I will not go through the submissions that I have prepared for the ECDs in terms of the presenter that dealt with the ECDs. I'll skip them and submit them later, Chair. But what I'm interested in currently is to go directly to the issues relating to social protection in terms of and questions relating to the National Treasury and stakeholders, and to IRR Liga. They spoke about the reduction to reduce BEE. And they are pleading for a value for money that they brought from the public hearings that I don't know where they brought them from. But what is the rationale behind the extreme opposition to the Black economic empowerment in light of the historical burdens that we have endured under apartheid, and in light of the equalitarianization that we seek to put forward in terms of ensuring equal redistribution of wealth and equal distribution of the economy. And they also spoke to the issues pertaining to the IMF and the debt service costs and the World Bank to some extent. And they spoke very proudly about how these things are happening. But I'm sure that we have been advocating for quite some time for the tools to decolonize the economy of South Africa, to localize production, to empower Black-owned, worker-owned, locally based enterprises in doing so. And what is their alternative in terms of doing away with the BE premiums, as it were? On the issues of relating to, I just want to bear with me, to Rural Health Advocacy Project. What concrete figures do you propose for a rural health conditional grant separate from provincial equitable share allocation? And then because, Chair, there is an issue of serious access problem that is exacerbated by the fact that there are no roads. And then there is economic gain that can be derived from fixing the roads in the rural areas with municipalities, and there is a economic gain, a local economic gain that can be derived from the ensuring that ambulances are able to access patients in rural areas, and therefore there's a disparity in terms of the urban and rural, and then there's a perpetual underdevelopment of rural areas in terms of that. And what is their thinking? What is their proposal on that? On public sector wage bill, Chair, to IRR, are your BE premium estimates not really just a small screen to perpetuate anti-transformational rhetoric under the guise of fiscal prudence? Can you explain how your recommendations are constitutionally sound in light of Section 217(2) of the Constitution? I just thought that I should ask that. On COSATU, COSATU, do you have a view on the manner on the in terms of deindustrialization of South Africa vis-a-vis the concentration of South Africa's economy into a few provinces, to the exclusion of rural provinces, and the perpetual state of rurality of rural areas, entrenching underdevelopment, and also the indebtedness, the debt service cost that we are perpetually indebted on, exposing us to influence into the neoliberal policies that we see, into the austerity and the fiscal austerities and underdevelopment of the ECD's state, as it were. Can you give us a view on that particular issue? And then I think in terms of just of equal education, I do think that they presented very well in terms of the disparities that you find in rural schools, and you find I mean the EFF gets to have a program in January. I'm going to finish. We get to have a program in January that deals with schools. And you find that if you go to a school in town, you look at the facilities and you look at the school, there is a lot, there's about 20 years of disparities, if not 40 years. How do we deal with that situation? Thank you very much.
Thank you, Honorable Teza. Honorable Numalo.
Chairperson, thank you very much for the opportunity. My humble greetings to you and all the members. Chairperson, I want to thank all the presenters, the good work that they've done to give us their view and also the recommendation. I acknowledge all that. Chairperson, I want to say my fellow members have covered me in some of the issues, Chair. I will go straight to the issue of COSATU, Chair, to say that COSATU, in their opening, they welcome many of the progressive provision in the 2025-26 budget, while raising strong concern around persistent austerity features and filled frontline vacancies, which is a problem, and other things that they've identified. Chairperson, I want to go to COSATU to say, in their view perspective, what key principles should continue guide the pension reform processes going forward? And the other issue, in their view, what urgent reform will you recommend for developing a sustainable new municipal funding model, which will assist us in our different municipality? What should parliaments demand from National Treasury to prevent backsliding on informal settlement upgrading? I will go straight to the next one, which is the TB Accountability Consortium submission, Chairperson. And also the consortium raised grave concern about South Africa's ability to achieve its end TB target amid the chronic health underfunding, donor withdrawal, and other things that are a challenge in that regard. Chairperson, in their view, how was the 6 billion annual health allocation over medium term determined? And is it sufficient to meet the scale of TB and HIV treatment in our area? The other one, in your view, let me go straight to the next one. What concern? Okay, this one, it falls under the issue of the ECD, which I think my fellow comrade has managed to cover it very well. Let me go to take the last one on the TB, Chairperson. In your view, or the 6 million, in your view, how does the current budget allocation enable provinces to achieve and not to achieve the ambition of end the TB campaign target of 5 million TB tests in 2025-2026? The other one, in your view, what interventions should be considered to close the 2 million TB test gap and address inequity in provisional diagnosis capacity? My last question, Chairperson, which is on page 6. In your view, what is the reprioritization of the district health program conditional grant adequate to safeguard TB service delivery? Chairperson, these are my questions. Thank you very much.
Thank you, Honorable Numalo. Before handing over to stakeholders to summarize the responses, Budget Justice Coalition, I want to appreciate your emphasis on the need for a permanent and inclusive social protection framework including the expansion of the social relief of distress grant. Now, how do you propose that government balance the need for sustainable social protection with fiscal constraints, and what role do you see public-private partnership in supporting social development initiatives? Kosatu, your presentation highlights concerns regarding the inadequacy of social relief of distress grant and its failure to keep pace in inflation. What specific measures would you recommend to adjust the SRD grant and ensure that it provides meaningful support to the millions of recipients who rely on it, and how could this be sustainably funded? I think for now, and then my last one is, I saw an emphasis from Equal Education. Their presentation emphasizes the dire state of school infrastructure, including the persistence of pit latrines and inadequate facilities. What steps do you think or you propose should be taken to address the significant shortfall in funding for school infrastructure? And how can the Division of Revenue Bill be adjusted to prioritize this critical need? Thank you very much. I am going to request that stakeholders, each of you, just try to summarize the responses of all members and give us your closing remarks as you do that. Thank you very much. I'm just looking at the time. Our meeting was set for 3 hours, so let's maybe try to extend it by 15 minutes. My apologies to all in the meeting. Maybe you have something planned beyond 12 o'clock. Let's just give it 15 minutes for responses and closing of the public hearings. Thank you very much. We'll start with the Rural Health Advocacy Project.
Hi, everyone. Thank you so much for your questions. So we agree that teachers are not necessarily the right people to provide healthcare services. However, schools do play a really important role in supporting learners' healthcare. The stigma around going to clinics, especially for sexual and reproductive healthcare, often actually starts at the school level. So we think that this needs to be addressed through wellness campaigns. We need to support school environments and have stronger referral systems that actually link schools to nearby clinics. Learners should also feel safe and empowered to access healthcare services without fear or shame from those working in these facilities. We need to promote clinic usage through youth-friendly education and outreach programs, which can also then reduce stigma and improve healthcare outcomes for rural adolescents. Regarding the questions of accountability and the conditional grant, I'll combine this into one thing, as we believe that to improve accountability in rural healthcare, Treasury should actually be rural-proof by spending time and asking how each budget decision actually addresses rural challenges like long distances, the short stoppages, or the poor infrastructure that these areas face. Funding should also be focused on real outcomes, and it's not just about spending figures, but rather looking at whether antenatal care or contraceptives or diabetes treatments is actually reaching our rural communities. We need rural voices, especially rural healthcare users and their workers, to actually be a part of the planning process to ensure that local realities actually shape the decisions that are made. We want Treasury to please keep track of these donor withdrawals and ensure that services like TB and HIV are still taken care of despite these disruptions. Rural standards should also focus on equity because providing care to those is what is important. That's what Chapter 27 says. Section 27 says, sorry. This means targeted support for rural issues. We should attract funding to retain rural healthcare workers in these areas, but also invest in long-term infrastructure. So in short, we should just break stigma at schools and also just rural-proof our budgets with targeted and accountable funding that can actually help with real lives, ensure equitable access, but also improve the healthcare of those in our rural areas. Thank you so much, everyone, for your time and for your questions.
Thank you very much for the response. TB Accountability Consortium.
Thank you so much, honourable members, for your questions. To Honourable Ryder and Brits, thank you so much for your commendations. I sort of broken it up in terms of the accountability mechanisms as well as then the funding allocation requests. as sort of, the big two parts that were, obviously being asked. In terms of accountability, I think the best place to answer, the accountability question is actually the National Department of Health, who are responsible for policy. They're the ones that actually have put together the National Strategic Plan in terms of HIV, AIDS, and TB and STIs. And I think through those mechanisms, National Department of Health are needing to be, the ones that are ultimately, responsible as to how the outcomes of these are actually happening. I must also, underscore, honorable members, that some of the responses might be for things that were as normal prior to January 20. And I think we are sort of needing to now, have, responses that are, quick. And there might not be things that are actually in line with the processes that we actually are having now. And so because of that, we currently have a shortfall. From year to year, there was the 6 billion that we had mentioned, that was going to be over the medium term. That is not enough. The preposition was for 33 billion per year, not for 6 billion. And I think that is, something that National Treasury, as well as the National Department of Health, need to have an urgent, intervention on. So our call is for a special, portfolio committee on health, as well as the appropriations, which should include representations from all provincial departments. I think, this kind of extends to one of our recommendations that we are needing for a special sitting, concerning that, because, we sort of had 17% of the health budget suddenly being pulled. We're needing urgent intervention. And I think this sitting, or this NCOP, as well as National Treasury, should actually have the sitting sooner rather than later, so that lives are not being lost. Sorry, I'm just going through my responses. Yes, so 6 billion is not sufficient. Honorable Nxumalo, interventions for the 2 million gap. Again, we're needing to have, this joint sitting, within appropriations, finance, and health, so that they can actually give you, the real-time responses as to where the need is. The first gains that we can have are the high-burdened provinces, have interventions and engagements within those, 3 high-burden TB provinces. Is the district health program grant sufficient for TB interventions? Currently, as it stands, it is not. There is approximately 1 billion allocated out of a 28 billion funding envelope for TB. We're needing more. So for a start, we need an additional 600 million to meet the testing gap for the NTB strategy. We are also needing 4 to 6 billion for the close the gap. So I think, outside of percentages, these are the real-time actionable things that this committee can actually do. So yes, that is all from us. Thank you so much for your questions. If there is anything else that we have left out, we will be sure to engage with Mr. Nodada and send those responses to you. Thank you so much, Honorable Chair.
Thank you so much. Section 27, Mr. Ngosi.
Thank you, Chairperson. So to answer the questions that were directed at Section 27, the first one, I think, was Honorable Rider on accountability being prone to political interference. And for that, we'd like to say that already there exists a number of entities within the state that are supposed to be impartial. The PSC is one of them, and we believe that that's a way that we could use to ensure that there's accountability in provinces, that they could entities like the PSC can be empowered to do much more of the work there and to investigate cases where there's malfeasance. We believe that the SIU also has a role to play, even though this one circles back to the interference part where the presidential proclamation part of the SIU's work would make it much more prone to political interference, but I believe that they also have a role to play there. On punitive measures or sanctions for provinces that underspend on conditional grants, from Honorable Swart, we don't believe that punitive measures or sanctions should be taken upon provinces. However, we do believe that first, there should be more capacity building for provinces to be able to deliver on the goals of conditional grants and closer monitoring of how provinces spend the money that they're given conditional grant. Failing which, there's also the option of national departments and national treasury spending the money on behalf of provinces and delivering what we call a finished product. I believe those are the only questions that we had for section 27. Thank you, Chairperson.
Thank you so much, Budget Justice Coalition.
Yeah, thank you very much. So we had a few questions, and thank you also for all the great feedback around the presentations and also for the really important questions that you've asked. So the first point was from Honorable Ryder around disaster funding and contingency reserve. So that's definitely that's a really strong point, because especially when you consider that this year our contingency reserve is narrowing and narrowing, and so in that context, it just seems, you know, are we prepared for any form of disaster that could that we may not be able to predict? And I think that it does speak to quite a reactive fiscal policy around increasing frequency of disaster rather than proactively building municipalities, schools, clinics that are resilient to disasters. And it's also true not just in coastal provinces like the Eastern Cape, Western Cape, KwaZulu-Natal, but also, you know, we've seen it in Limpopo and also seen it in the Northwest and the Northern Cape. So completely understand that point. And then another point also, just to jump on the comments about ghost employees, because we also covered that in our submission, is that what we've asked Parliament and this committee in particular, what we'd like to see their role in strengthening oversight regarding that is that, yes, it's true that there is a balance when it comes to politics, but we don't really require Parliament to manage the operations, but rather to hold departments accountable for the integrity of their staffing. So what that would look like would be requiring departments to provide disaggregated personnel data, the payroll audits, for periodic headcounts, biometric verification in sectors like education and health, and to also link budget approvals to clear progress in resolving these anomalies. So I think that covers or supplements the point about ghost employees. Then Honorable Majola asked about the fuel levy and if there are alternatives. So there definitely are alternatives that we could use to replace indirect taxes like fuel levies and VAT increases, namely being as the Budget Justice Coalition, we've seen phasing out ineffective corporate tax incentives as one of the ways that could claw back up to 27 billion. And we could reallocate that towards employment incentives that actually accelerates job creation rather than what the current situation that we have right now, which is not really working, especially for young people in our country. We also call for redistributive taxes like luxury taxes, including luxury taxes, and I think also inheritance taxes. And we could even get up to 160 billion around that. And I think that Kosatsu's also covered that. We also then speak about stopgap measures like the Government Employment Pension Fund as a stopgap measure. That's something that we we propose that could be explored by governments if there's an urgent need, instead of that 4 billion fuel levy increase. So there really are options, and I think that it's up to it's around political will. As we've noticed the budget process being about it. It really is. It's not just about feasibility, but also who carries the burden. And we're really calling for economically vulnerable households to be better considered in the process. Then from Honorable Ndlovu, around community needs, where this committee has failed to address community needs. So our position as the BJC is actually not that the committee itself has failed. So I just think that because the budget is becoming more relevant, and as we've seen so many more submissions in previous iterations, that there seems to be a growing interest by community members to actually shape the budget, which is what we should have. And so what we have called on, and I'm glad to hear some of the members in the committee supporting this, but to get to institutionalize public participation from the budget formulation point, which I believe starts at around July. So to have these pre-budget consultations so that community voices and people's voices can be incorporated in that. And the role that the committee can do is to call on this from National Treasury. We as civil society have done that, but to ensure that Treasury actually commits to that in this budget cycle. And then for the provincial equitable share, Honorable Ndlovu also asked about what this committee can do is that this committee can press for urgency on delayed reforms, long delayed reforms to the equitable share formula and sector funding frameworks. Sorry if there's a bit of background noise. I'm in Braamfontein and it's getting a bit noisy now. So we can also these formulas, we can also recommend that Parliament sets clear timelines for the finalization and implementation of these revised formulas, to insist that the formula changes should be informed by public consultation, especially with frontline service workers, like community healthcare workers especially, and teachers as well, and service users, and also to demand transparency in the modeling assumptions that are used, particularly around population size, around whether it's urban or rural provinces, the infrastructure backlogs, and all of those things that are weighted. So I hope that answers that. For Honorable Brits, yes, we support the points about local governments and this white paper as an opportunity to reform local governments and improve the way that it works. From Honorable Swartz, thank you for acknowledging the pre-budget engagements, and we really call on this committee to hold government and National Treasury to account to take these forward. And then for around how much what government should be doing, what basic education funding should be looking like, I think we should be tying it to, as a country, we should be spending the most on basic education, which historically we had been doing, and there had been a lot of progress around that, but then that has stalled because now we spend more money servicing our really expensive debts. And then on gender-responsive budgeting, who should lead this? The department that should be leading this. We are happy that Treasury is working with, so it's Treasury, it's Stats SA, is the Department of Women, Children, and People with Disabilities, and we welcome that, but we're really calling on reforms to expand it to not just be, housed within those departments and looking and more of a tick box exercise, but to expand it to include care sectors like education, health, and social protection. And on that note, what reforms are needed, I think we can learn a lot as a country from how Rwanda and even Zimbabwe have been doing gender-responsive budgeting, is that they've actually, Rwanda particularly, has actually invested in gender-responsive budgeting within National Treasury, whereas in South Africa, those officials are undercapacitated regarding that. So the last question, sorry, I just had a lot of questions, but the last point that is just to answer your question, Honorable Chair, which is around balancing the SRD and social protection. And yes, we understand that the short-term fiscal constraints are real, but the deeper structural constraints on sustainable social protection is our stagnant economic growth and our deindustrialization. And so we really need to invest in labor-absorbing sectors. And if we don't do that, we'll always be in a cycle where the tax base is too narrow to fund the SRD grants, among other things. So I'll stop there. Thank you very much. Thanks for your.
Thank you. Equal education.
Thank you so much, Chair. I will try to summarize as quickly as possible. Thank you so much to all the honorable members for both the comments as well as questions. They are well noted. I think in relation to the remark about the launch of the Rapid School Build program by the Western Cape Education Department in particular, of course, we acknowledge it. It's welcomed in terms of responding to school infrastructure rollout. But at the same time, and by the Western Cape Education Department's own admission, we do want to highlight as EE and EELC that this program won't necessarily address the existing backlog. It currently aims to build 26 schools in the next 3 years, but the backlog is actually a total of 60 over the past 10 years. I think secondly, just to add to that, it doesn't accommodate population growth or growing learner demand. We also note in the context of the Western Cape, since it was raised, not necessarily on our end, the concern around growing teacher cuts, staffing shortages with just over 2,400 odd teachers no longer in the system in January this year. I think in terms of the question around barriers to fulfilling constitutional mandate, we had emphasized that this was the case over the last 3 decades, right? But in the context of this new coalition government, we want to highlight that in as much as strides have been made in terms of the remark made around three rounds of budget. I mean, for example, in the second round, it was in fact the courts that had struck it down, and also mounting pressure applied by civil society, workers' movements, and just ordinary members of the public to demand just and equitable budget choices. And we want to emphasize the need for honorable members to acknowledge the role thereof of those different stakeholders in shaping the outcome that we currently have now, but also emphasize that in terms of the role of committee members now moving forward is that this is a continuous exercise, and there's a lot more to be done. And we'll use once again the example of unfunded mandates and the situation that those unfunded mandates continue to create in the form of non-alignment between legislative mandates and resource allocation, and the distrust deficit or trust deficit rather that it creates between members of the public and parliamentarians when, for example, parents, just using that example of the grade R mandate, parents are told that grade R is compulsory, yet in reality, due to lack of resource allocation, it's not yet equally accessible. And it also just creates weakening of the rule of law when legislation is effectively nullified through budgetary processes rather than proper legislative amendment. And that's what we were trying to highlight in that particular regard. In terms of the question relating to the ECD grant and how we got to that number, we actually looked at Ilifa Labandwana's model, and I will share a link just to save time in the chat for honorable members to have a look at that survey. But in a nutshell, that figure, honorable member who had raised this, is considered to be around 45 Rand at the moment, and it takes into account the full cover of costs of a basic quality ECD program after having surveyed those ECD centers, and that's how the number was derived at. I think on the question of provincial equitable share, we have emphasized what the impact means in terms of the disparities amongst resource allocation, particularly in regards to poorer provinces and the greater demands on them. I think in terms of infrastructure, we've also emphasized what the direct impact of that is. And then lastly, on scholar transport, our proposal is that Parliament should ultimately collaborate with relevant departments to develop what we feel should be a comprehensive framework that streamlines funding mechanisms and strengthens accountability. And actually we propose that a conditional grant specifically for scholar transport services be introduced. I think also just to point out again, Chair, that
can I request that because of time, can you please respond in writing to the remaining questions of honorable members and send the responses to Mr. Nodada, and Mr. Nodada will share your responses with members. I am afraid members are sending messages, will end up responding to only myself. on the platform. If possible, may you kindly be given that space to respond in writing, then forward your responses.
Absolutely, Chair. Thank you very much. Siyabonga.
Thank you for agreeing, Sam. Institute for Race Relations and Legal, NPC.
Thank you, Chair. I'll keep it brief. I first want to note with great enthusiasm the committee's tacit assent, I think it's fair to say, to the proposition put forward by IRR Legal, namely that the appropriation bill in its current form reduces BEE premiums to R0. We explained that, no one objected to that. So if the thing goes forward as it is, I think it'll be clear that the Act will not only have that effect, but that it knowingly has that effect. And we're very glad about that. In response to the question about our opposition to BEE premiums in light of historic injustice, we refer back to the Zondo report, which recommended value for money rather than BEE premiums. I think any member in the committee can apply their minds to why would the Zondo report do that. It was confronted by state capture, which ultimately steals from the public purse, which makes the poorest people the worst off. And those who are the poorest are overwhelmingly Black because of the legacy of apartheid. And they are also overwhelmingly the predominant victims of state capture. So the reduction of the premiums in the Zondo report was related to state capture. That is one reason. Another reason is that Black unemployment has doubled in the major BEE era, from 5.5 million in around 2007 to more than 11 million today. And our position, which has been substantiated in writing in several reports, is that the increase in value for money service delivery will help make the South African economy more efficient at increasing job opportunities, which again will help the most vulnerable members of our society the most. The next question is on constitutionality of 217(2). That section says when government funds are spent through this allocation and division of revenue, it must be done in a fashion that, I'm going to paraphrase, that helps transform South Africa's situation from the legacy of apartheid into something better. And our submission is that when you do maximum value for money appropriation allocations, as this bill does, then that is helping transformation, because it's helping maximum value for money in all government spending. And then the final question is, what's our alternative? You know, given that these BEE premiums are being reduced by the appropriation bill, and if the division of revenue bill is amended as we suggest, given that even more BEE premiums will be reduced, what do you do with that money? Well, as we said in our presentation, there's a reported shortage of 60 to 80,000 classrooms in this country. And given that the annual associated costs with BEE premiums are estimated to be 150 billion rand, if you oversee the reduction of BEE premiums to zero, that will create the fiscal room to add 60,000 classrooms in the next 3 years to reduce that overburdening and improve the situation for students. And we think that's real transformation. That's not fake elite enrichment transformation. That's real transformation that really makes the country today, tomorrow, better together. Thank you very much.
Thank you, Gabriel. The last one will be Kosatu.
No, thanks, Chair. And, perhaps one could also just send some comments in writing too. But I think, Chair, on local government and the white paper, we hope it really can deal with a real systemic cause of local government's collapse on many fronts. Because I think all of us agree that if you don't turn around quickly, we're going to be in deep, deep trouble. Chair, we think on alternative revenue, we do appreciate, the Parliament's efforts to reverse the VAT hike. Would have loved to see that done for the fuel and the PIT brackets as well. But I think our main focus on revenue really is about giving support to SARS. About a third of taxes owed to the state are not collected. And I think giving SARS more support, that's the most effective way to collect more tax revenue. That's, there's a debt burden or tax owed to SARS is about 800 billion rand. We will generate some additional money through tweaking of wealth taxes, whether it's on inheritance or estate, etc. But I think, to be frank with members, it'll generate a few billion rand, which is welcome if every bit helps. But I think for us, the major focus really has to be around capacitating SARS to do a tax evasion. Chair, on the ghost employees, and I'm just galloping, one could put more in writing. We think, in past there was about 3,000 ghost employee posts which were found. We suspect that, and obviously no one will have exact numbers by the nature of a ghost employee. We suspect you might find some in some municipalities, some entities. I think public service is more difficult, given what is already done there, but you might find. But look, I think even if you find only 10,000, 20,000, whatever it might be, that's money saved, and that's money that we can then use to fill frontline vacancies. Chair, on informal settlements, look, I think the other member also raised it about the migration from rural areas to cities. There's a real need for land. There is a need for a new housing model, and to make sure that we give people the full support they need. But when it makes it difficult when you cut back on a formal settlement allocation to justify or to balance that rather. Chair, we think the pension bill was largely administrative. We had no objections to it. And on the public employment programs, Chair, we think, look, there's some good models of the presidential stimulus program. It's done well to link to the minimum wage, to provide the skills and training opportunity and experience opportunities participants need. EPWP and community works program don't have that same positive experience. We think there's a need to have a discussion about how do you pool resources together? How do you really make sure that the participants receive the skills and experience they need to find work afterwards? And how can you link it even to supporting people who want to establish SMEs? Chair, just linked to that on the jobs front, I think for us, to Honourable Swartz, the key thing is to, well, one, expand the public employment programs as a temporary relief, but to deal with the economic growth, which is done by fixing SOEs, fixing economic infrastructure, fixing municipalities, providing stimulus into the economy through infrastructure, ramping up financing programs for SMEs, for industrialization, and of course, including public sector financing too. As well as also amending Regulation 28 as well to focus really on domestic investments. I think for us that's critical to take us to the 3% growth. And Chair, Honourable Claes is right. We need to really have a greater focus on rural areas. The urban migration is not sustainable. And again, the dysfunctional municipalities is adding further impetus to that. I think, Chair, just last three questions quickly. I think on the SED grant, Chair, number one is to recover value lost to inflation, to have a pathway towards the food poverty line, but also, as the Minister says, to link its participants to skills and employment opportunities as well. And Chair, on the pension reforms, the two-part pension reform has done well. It's given 46 billion rand relief to 2.5 million workers. We made further proposals to Treasury, at NEDLAC and in Parliament, to allow workers who have lost their jobs to get full access to their savings, to allow workers to choose to access money from the vested pot, to transfer to the two-pot and thus get greater relief. But also we need a discussion, Chair, about how can pension funds be invested more to support the local economy, jobs, industrialization, etc. And then I think lastly, Chair, I want to put this in writing because there's a lot of questions. To Honourable Kleza, I think for us, the issue of the debt is not so much the current levels, but it's the growth in the past decade, where it's basically tripled. We need to have less debt, which is foreign denominated, because the problem with foreign debt is that the rand does depreciate and there is strings attached. So I think for us, it's about getting the right balance. But again, Chair, we have to deal with the fundamental issue, which is growing the economy. Otherwise, you won't be able to service the debt. But I think, Chair, so many questions. Let me put it in writing, because I can see you're under overtime pressure. And let me stop there, Chair. Thanks for the indulgence, Chair. Thank members.
I am so sorry for that, colleagues. The time issue is beyond my control. Let me then take this opportunity and thank the honorable members, both from the NCOP Select Committee on Appropriations and from provincial portfolio committees on finance, representatives of civil society, and colleagues from the National Treasury. Allow me to express our appreciation as the committee for your valuable contributions today. The insights shared have been both frank and constructive, reflecting the realities of our communities face and the critical role that you play as civil society will continue to play in advancing social justice and accountability. Your voices are not only heard, colleagues, but they will directly influence the committee's report and will ensure that the executive is held accountable to respond meaningfully to the issues that you have raised. As a committee, we remain committed to an ongoing dialogue and a conversation with you, as well as the partnership that we have as we collectively work towards more inclusive, equitable, and accountable society. I thank you very much for your efforts, your time, and your comments that also assists the members of this committee to play their oversight role. Thank you very much, colleagues. I am going to request that stakeholders vacate the platform. I have a 2 minutes announcement to make to honorable members. Thank you very much, colleagues. Your responses will be highly appreciated, and the responses from the National Treasury will be shared with your good selves. Enjoy the rest of your afternoon. Members, I only have a 2 minutes announcement that comes from Honorable Swart that I need to share with honorable members. Colleagues, I have received a note from Mr. Nodada from Honorable Swart. Honorable Swart was just letting the committee know or making the committee members aware that his wife is not in a good condition in hospital. We can remember that last week he attended our meeting seated next to her in hospital. So the situation is now becoming a bit severe. And he requested that maybe we are made aware as members of the committee, and requested that he will be in and out of our meetings, and he will attend meetings. Most of the time he will attend our meetings when they are virtual, and there will be instances where he'll not be able to attend meetings. But I think the leaders from the DA in this committee will deal with the issue of looking at who will be an alternate in his absence in the meetings. But on behalf of the committee, Honorable Swart, allow me to say we note your I can say your plea with us, and as members of the committee would like to say we wish a speedy recovery to your wife and will always be with you during this trying time. And we appreciate that it's not every time that one will share such sensitive issues with their colleagues. It shows the manner in which we consider each other. We are family as the Select Committee on Appropriations. So speedy recovery to your wife. When you are with us, we'll always acknowledge your presence. And when you are not with us, we'll always consider that you informed us in time that you sometimes need to be home with your wife. Colleagues, thank you very much. And I am so sorry for the prolonged meeting. I know that we all need to be in the house. Enjoy the rest of your evening. Thank you so much.
Thank you, Chair.
Thanks, Chair.
Long live the chair.